Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by Pastor Tim Woody from the City Life Center, Fort Worth. Thanks for coming out today. After the invocation, please remain standing for our pledges.
Let's pray. Oh, most sovereign God, we come today to pray blessing over this first gathering of our Tarrant County elected representatives in this new year. God, I want to thank you for these commissioners. Thank you for their diligent work, and I thank you for the way they strive to govern my great county. God, I pray that as they make decisions today regarding infrastructure, transportation, expenditures, and the needs of all us people, I pray that you will give them the wisdom of God, and that will be present in this room. Pray specifically for Judge Whitley as he presides over the proceedings. Also pray blessing over all the commissioners. God, I pray that you'll bless their work, bless their families, bless their homes, and I pray that our Tarrant County leadership will continue to be marked by strong ethics, compassion, creativity, humility, and wisdom. May the Spirit of the Lord rest upon them, the Spirit of wisdom and understanding, the Spirit of counsel and might, the Spirit of knowledge and the fear of the Lord, and give them sharp minds and a diligent spirit, especially as they deal with all of the unique challenges in this very turbulent season. God, I pray that no plague, unrest, violence, mockery, or hatred discourage any of these leaders, and may they bring you honor as they serve us 2 million, these residents of the best-run county in America. God, I also pray that you will be enthroned above all else right here in Tarrant County, so may the glory of Almighty God shine brightly from this place, for we invoke your presence here now. Holy Spirit, you're welcome in this place. In Jesus' name, amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you, Reverend.
Thank you, Pastor. Mr. Manius.
Thank you, members of the court. As we get into the agenda today, we're going to take certain items out of order as we have historically. Besides the order issue, there are no announcements as it relates to any specific item on the agenda. However, whenever we get to the administrator section, the first item, we're going to go ahead and move to the briefing agenda, and we're going to go ahead and ask Vinny to make his presentation. As we get into the county administrator section on items A1, we're going to go ahead and have several different presentations for you this morning and work through those processes. I believe that we'll be able to move fairly quickly through the agenda today. Therefore, the presentation relating to the PSA that's on briefing is going to be something that we'll cover whenever we get to the briefing section. Thank you.
Court members, you have before you the minutes of our regular meeting of December the 29th.
Move approval. Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Okay, we're the first.
Before you go on,
Go right ahead.
I would like to ask that we adjourn court today in memory of 2 persons who have made a tremendous impact on our county and its citizens. The first is Mr. Dennis Duncans, longtime educator, community leader, businessman, who worked with children to make sure that they knew that they had opportunities to go to college. He was the magnet school coordinator for the Fort Worth ISD for many years. He organized that program. He was a first magnet school director. But in addition, he took kids every year on a tour of historically black colleges and universities. And many kids ended up going to college that never thought college was an option for them. Dennis Duncans will be tremendously missed in our community for those and many other reasons. The other is Clyde Peast, who served on the Fort Worth City Council in District 6 for many years. Clyde was a retired lieutenant colonel, and I believe the Air Force. Over the years, Clyde and I didn't agree on much.
There's a lot of us
But
who
we
probably say that
did
about Clyde.
agree that public service was a noble calling and was a good way to spend one's life. Everything other than that between me and Clyde was just noise. The agreement on public service grounded us and got us to a place where we could work together in spite of the noise. Clyde was a good man, a great public servant, and he will also be missed.
Thank you, Commissioner. We'll be sure that that's done for our meeting. This is the first Tuesday in January, and again, we are postponing our employee recognition, but we are going to go ahead and run the little video, and we're going to catch up. I know I keep saying that, but we are going to do that. Go ahead. Good morning. Because of the COVID-19 virus, we have, and the restrictions on our meetings, I'm sorry to say that we're going to have to postpone our employee recognition. That is one of my favorite times of the month, and so I'm sorry that we're not going to be able to do that this month, but I promise you that when everything gets back to normal or whatever our new normal is, we'll begin those again, and we'll make up for those meetings and for those months that we've had to miss. Again, I want to thank you personally for what you do for Tarrant County, especially during this time when we've had to face the challenges of the COVID-19 virus. Our employees have always stood up for the test, and you've done exactly the same thing during this time frame. You're what makes Tarrant County such a great place to live, to work, and to raise our family. Again, thank you very much, and I look forward to getting back to our routine of being able to recognize our valued employees on that first Tuesday of every month. Thank you. We look through, I see under our 30-year employee, Miss Glenn, is celebrating 30 years in Tarrant County today. Julie Parks, I don't see her here, but I know that Julie is celebrating 25 years with us. And there's probably some other folks here in the room today that are celebrating, but again, I'm looking forward to being able to get back and to resume the phone calls and to get into it. And there you see the names being screened across our monitors, whatever we call all that. So again, we'll get back to that eventually. 910 total years of service. And I've always said that you, the employees, make the difference. It has never been more true than as it has been this past year as we have fought the COVID virus, and I cannot even begin to tell you how much I appreciate the jobs that y'all have all done. Okay, are there any other announcements at this point in time? And I'll move that we receive and file the employee recognition.
Second?
We have a motion to second.
Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Are there any other comments or statements anybody wants to make at this time?
Happy New Year.
Happy New Year. Okay, so next you have before you the consent agenda.
Move approval of the consent agenda.
Second.
We have motion and second to approve the consent agenda. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Mr. Manius?
Thank you, Your Honor. Members of the court, if we could now go to the briefing section and item A, which is the current and emerging health issues, ask Mr. Tenasia to come forward to make his presentation.
GK, I can't hear you.
Commissioner, can you hear me now?
Yeah.
Okay, thank you.
Well, good morning, everybody, and we're here for our weekly briefing on the emerging health issues. So with a COVID update. So situational awareness, it's no secret we've got a lot of disease activity going on in Tarrant County. Unfortunately, the Christmas spike is starting to hit. Last week, I think you all saw the numbers. They were 3,000, 3,300, 4,200 on one day, but that's a two-day count. This morning seems a little bit lower. I think we're under 2,000. So that's relatively good news. But overall, 161,000 cases. We're going too fast. Too many cases happening. Last week, the week of Christmas, we reported out over 19,000 cases in 1 week. That is just a huge, huge spike. And more to come because, the holiday effect is going to linger for a little bit. 1,550 deaths in Tarrant County so far. I think we're adding another 8 or so this morning. Hospitalizations, uptrend is continuing. Our hospitals are full. We have 1,426 patients with COVID. It's getting everywhere. So it's in the hospitals as patients. Staff are getting sick. They're trying to manage the best they can, but we're 31.7% of the hospital available bed capacity is consumed with COVID. And I believe 38% of the people in the hospitals in Tarrant County have COVID. 272 are in the ICU. That's 51.7%. Of all the people in the ICU that have COVID, the capacity is consumed with COVID. 1 in 5 total patients that have COVID end up in the ICU. So that's a 20% ICU requirement. As the numbers grow, that requirement's going to grow. And as you can see, we're again down to about 9 ICU beds remaining in Tarrant County. So one thing I want to point out, we've talked about this every week. We're 6 beds, 10 beds, 9 beds, and the numbers keep growing. How is that happening? I got to give credit to our hospital partners for really trying to manage that. They're trying to increase bed capacity, but they have staffing challenges, and they're also trying to triage other people that may have needed ICU care and trying to treat them outside of the ICU. So they're doing a good job keeping the beds available for absolutely critical functions, but that puts a pressure on the healthcare system. It lends to poor health outcomes elsewhere. People who may have cancer, people who may have heart disease, may need ICU care, and we need to save that capacity for those type of critical events. Somebody with a massive trauma. Things happen in life that are still happening despite COVID. TSAE is no exception. 24.65%, almost 25% of our TSAE, the 19-county region, is consumed with COVID. The hospital capacity is full with COVID. 3,844 people in the 19-county region. We're 64% above the threshold of 15%, which was already very high, as you can imagine. By the time we got there, we were all feeling the pain of COVID, and now we're 64% above that. TSAE is the leader in all of Texas. Our region is suffering the most. Houston area is a distant second with only 19% of COVID hospitalization. So we've been saying this for a while. We've got to do our part to keep this at bay. Otherwise, we're in a lot of trouble. 70 ICU beds for the North Texas area for the TSAE. So that's hospitalization. Again, there's nothing I can say in here that's any surprise. Again, we all got to do our part.
You know, I will say this on the hospitalization
Yes, sir.
rate. A lot of times, it just happens to fall with how many beds you've got. And while Harris County is certainly a little over twice as large as in population as Tarrant, they have over 3 times as many hospital beds. So that also has a consequence to that calculation. And, you know, that's just in Harris County. That doesn't include the surrounding counties of also that are in their bill. But at the same time, Tarrant Counties doesn't include the surrounding
Absolutely.
counties on there.
Yes, sir. You're absolutely right. Hospital trends, again, you know, this is Tarrant County data. You know, we're spiking hard, as you can see, and there's really no sign of slowing down. TSAE in the same situation, spiking real hard. You know, our epi curve for the case counts, the way we look at the outbreak happening in the community, as you can see, is big peaks in the recent weeks. And of course, the case volume is a different epi curve that kind of shows the workload that our public health team and our hospital systems are dealing with. Because these folks some of them are in the hospital, and some of them are out in the community being sick. So they're being seen, they're being tested, followed up with public health. A lot of happening, as you can see, a big spike, 20,000, close to 20,000 cases, you know, 19,000 and some change in the previous week. Case rates, we've talked about it. The federal government, the White House task force set up you know, a ceiling, so to speak. This is where they thought things were going to get bad, 100 per 100,000. And this is based on a lot of science, right? You know, most diseases are lower than that. Only a few that are sort of insidious, spread quietly, you know, get higher case rates. But most illnesses don't have this high. We're 6 times that. We're at about 600 per 100,000. I can't really see all the numbers, but we've touched 600 and come back down a little bit. And mortality data is starting to follow as expected. It takes a while to show up in our records, but people are dying with COVID, and we've at least matched what we saw in July. There was one bar that was higher, but you know, I think we're getting there, and more to come because there's just been too many cases. COVID-like illness, again, spiking, and then the positivity rate is an unbelievable number. We're at about 25%. I think we hit at 29% and came down a little bit. So it's going pretty hard. I mean, 1 in 4 people getting tested, and I think over the weekend, holiday weekend, we saw 1 in 3 people coming back tested as positive in Tarrant County. And we're not alone. The state of Texas is raging with cases. Their positivity rate is over 20%. And that is 1 in 5 people all across Texas getting tested are coming back positive. So it's a lot of disease activity all across Texas. So what can be done? And I know that, you know, the governor's orders allow us to do only certain things. But community mitigation efforts, when we put them in play, they work. They must be available as an option. In the absence of that, there's very few things that can turn the tide for COVID. There are therapeutics. There's efforts underway to open pre-hospital infusion centers. I believe our emergency management folks might have an update later on that. But what they are related to monoclonal antibodies. We've talked about, our president got the, I think the Regeneron treatment, and there's another company, Eli Lilly. So they both have monoclonal antibodies, and those treatments are available in Tarrant County. What they do is, generally for most people who take it, people feel better in about 3 to 4 days, 75% improvement in symptoms for most recipients. But the real benefit is about a 5% reduction in hospitalizations of all the people who take it. And when you're that full on hospital capacity, every percentage point that we can knock off really matters. So again, I encourage, TDEM has been the lead on this, the Texas Department of Emergency Management. And I appreciate their efforts and our county's efforts and city's efforts who are trying to pull this together. And the final thing that we can do is a strong vaccine uptake. I know the numbers are limited, and we're going to talk about that a little bit. But as vaccine becomes available and people become eligible, we really need to take that vaccine, because that's one sure shot way to calm down the COVID outbreak, because otherwise we don't have other tools available at this point to do anything that will stop the spread. So if there's any question, I'll be happy to answer, but I know there's probably going to be a little bit, either Mr. Manius or Mr. McCurdy might have an update on the pre-hospital infusion centers.
So let's talk a little bit about the infusion center right now. We're currently, emergency management is currently working with TDM and the state in an attempt to set up an infusion center here in Tarrant County. We are still in the development stage. We found a location we believe is going to work. We don't want to necessarily reveal that location right now simply because we don't know if that's going to be the final location. But we do want you to know that we do believe that we will be able to set something like this up. We're looking at maybe at any given time, 10 to 15 individuals at a time can receive the medication, and hopefully within the next week or two we'll be able to provide some additional information to you. This will only be one of 2 or 3 sites across the state that actually has an infusion center that is not inside of a hospital itself. So we're working on that. It looks very positive. Once again, we have to compliment our partners, Texas Department or Division of Emergency Management. They've stepped up on this thing, and as I said, hopefully within a couple of weeks we'll be able to introduce this site to not only the court but also the community.
GK, I know that right now we are operating in an environment where the vaccine is a scarce commodity.
Yes, sir.
But that will not always be the case. I think that in the next week to 2 to 3 weeks, as we get more and more vaccine deliveries, we will have less and less pressure on the system from having a limited supply of vaccine. We need to use that period of time between now and when the vaccine becomes plentiful to gear up to vaccinate everybody in Tarrant County. We need, in effect, a place to get a shot on just about every corner in our community. Certainly in every neighborhood in our community. Since the availability of the vaccine, nationally, we've only immunized a little more than 4 million people. I've heard a goal put out there that we should be vaccinating 1 million people a day across this country. And that even if we get to that goal of vaccinating 1 million people a day, it will take 300 days to vaccinate the entire population. Well, this is a massive undertaking, and we can't do that without having a plan. I want us to have a local plan for how we're going to vaccinate our county. Infusion center is great. We probably need 40 or 50 of them instead of just one. There are many public facilities that we can turn into vaccination centers,
Right.
whether they are JPS community clinics, public health clinics, WIC locations, FQHC sites, community centers, libraries, churches, synagogues, mosques. All of these people stand ready to lend their facilities and their staffs. Many of these churches and synagogues and mosques have retired nurses as members of their various congregations. These are resources that we ought to know where they are and how to reach out and get them and have a plan for a system of vaccination centers, including mobile units that go around the county.
So,
We need a plan.
So Commissioner, we have started working on a plan. It's not as intensive as what you've described. And I think that you have some slides on that, but when we get up to our section, we're going to talk a little bit about what we're doing in the near future, within a week to 10 days, and then step that out in the next 2 or 3 weeks. But those plans would include basically opening up sites that are mass vaccination sites, some that can handle up to 1,500 to 2,000 a day in vaccinations, those type of deals.
Let me put a goal out there for you.
Okay.
GK. I'd like to see us have the capability in Tarrant County to vaccinate 100,000 people a day.
Okay. We'll start working on it.
So before we move on, I had a question specifically about the infusion centers. I wanted to make sure that I understood. So hospitals can stand up their own infusion centers, right?
Yes,
through
they
their
do in the
outpatient-
outpatient setting. They've been
Okay.
doing that, yes, ma'am.
How many hospitals right now in Tarrant County have that?
I don't have an accurate count, but I've heard at least a handful have used it.
Okay.
Again, this has been sort of not the public health swim lane, it's
Sure.
hospitals and state effort. So we kind of on the outside know that there's at least been 5 or 6 that have in conversation said that they've been using it.
Okay.
And from what I hear, TDM has had some feedback that there's more doses sitting that are not being used. So the governor has tasked them to kind of get it out. So that's what the push behind this is, that they want to do pre-hospital infusion centers. Makes good sense to me because it reduces hospitalization, so we'll take it.
Sure. Well, and then, because here's what I want to be sensitive to is, my understanding is that in order to get the treatment through the hospital outpatient facility, you would need a referral from a physician, right? And not everyone either has insurance or has a PCP or whoever would provide that referral. So I imagine that our site would serve the general public, including those who are uninsured or don't have a referral.
So I'm a little light on operational details. Again,
Okay.
it's an effort between Texas Department of Emergency Management, our emergency management, and local fire departments.
Okay.
Some in direct contact with TDM. So they have a vendor, I know, that they've engaged. The vendor is supposed to bring a full turnkey package. So that's all I know. And I've tried to stay, out of that lane because it's
Okay.
between them and the fire departments and emergency management. Only thing they asked us was, what's the benefit? Should we do this? And I gave them the science on what's the benefit is, just like I shared with you. After that, it's been kind of their ball and they're running with it.
Okay.
So sorry, I don't have full operational details, just
Sure.
that they have a vendor that's gonna help them out.
Okay,
Yeah.
well, so then, GK, when you provide the next update, I would like to understand the plan to ensure that we are serving the greatest number of people with this public infusion center. Obviously, we know that COVID doesn't discriminate, but then there are so many factors that some are disproportionately affected by COVID. So I'd want to make sure, just like this and with the vaccine, that the distribution and the access is equitable. So,
Yes, ma'am.
okay, thank you. That's all I have.
So, again, just for, general public, we know there was policy discussion on the previous slide, but general public, what can we do? Same thing, get vaccinated, wear a mask, stay 6 feet away from others, and wash hands often. This is, by now, every child should be able to say this and do this, because this has been the mantra. This is the way out, and if people do it, we have a way out. So vaccination efforts, and we'll go into some of the details on what we've done and what kind of plan is there. And Commissioner, some of your comments are very well taken, but I can't share with you what the plan is from what we know. And then, of course, we'll add whatever the comments are and work on that as well. So vaccine interest has been very, very high, which is great news. Right off the gate, I want to say our community has responded very well, and we were worried that the response was going to be slow. But right now, the demand has outstripped supply. So that's great for us. It presents its own challenges, but it's great news in general. Over 160,000 people have registered through our registration portal. 136,000 are currently eligible. The others are eligible in future. So it's not like they're not eligible. They're eligible in the future when more phases open up. So 85% of the folks registering are currently eligible. That means they are getting the information, they're understanding if they're eligible or not, because otherwise the entire county would have registered if they did not understand. So only those that are eligible are truly registered. 8,364 doses have been given out as of yesterday just by public health and working with our partners in MedStar and the Fort Worth Fire Department. And 3,000 have been given out by Arlington. And let me be very clear. In the public sector arena, public health governmental entity arena, we're the North Texas leader, and I would contend to say, I've looked around, I think we're probably going to be the leader across the state in giving the vaccine out this fast. If you put the math together, between the two entities, we've run maybe less than 8 days, maybe 8 days, and we were getting given out over 11,000 doses. So that's working out to be, 1,200 doses a day between the two of us. Public health alone has given out over 1,000 a day on average, which included bad weather days, included holidays where it was hard. We invited people, they didn't show up. So there was a lot of moving parts. DSHS dashboard shows that Tarrant County has only given out 22,000 and some doses. I can guarantee you this data is way behind. Just talking to our partners, I'm pretty comfortable saying that we're almost double that amount that has already been given out. They've had some glitches in their dashboard and the data not reaching their immunization registry in a timely fashion and then not getting updated. They've tried to work on ways. There's a dual reporting mechanism right now. Report to DSHS and then report to TDEM. We're hoping to get that resolved with DSHS. But currently, I can guarantee you, and that goes into national numbers too. You mentioned 4 million. If this happens in multiple spots, I'm sure the number's higher, it's just not being seen. So
before you move on, that 22,000 number, is there a typo in that? Because did you say?
Is there a what on that?
Will you restate what this DSH's dashboard shows?
Yes, so the DSHA dashboard shows that we've only administered 22,776 as a county, but talking to our partners in the hospitals and what we've done in public health, we've given, public health and Arlington together have given over 11,000. The dashboard's showing we've given 6,000.
Okay.
So that means about half is missing. And I can tell you the hospitals have had a call with us. They're saying, no, we've done a lot more. It's just not showing up on the dashboard.
Okay.
So a lot more has been given than what is being shown on their dashboard.
So before you leave that slide,
Yes, sir.
so let's talk a little bit about that. There are multiple players who are giving vaccinations. And one of the issues what Vinny talked about was we don't have an accurate count because we send the data down to the state and there's an issue with the state system that it's not capturing all that data. It's not capturing it from the hospitals, it's not capturing it from the other counties, it's not capturing it from us. The hospitals have received an element, their vaccines, and they're giving out the vaccinations to their staff. And so that adds to the numbers that you see for Tarrant County. Vinny, do we know, I know that those individuals that are in nursing homes or in those in assistance facilities that the state is going to do that through the pharmacies. Do we know if they have started that yet?
Yes, sir. As of December 28th, so there was a federal partnership with CVS and Walgreens, and they were supposed to be immunizing our long-term care facilities, including nursing homes and assisted living. That program has started as of December 28th. Our staff did receive a statewide spreadsheet, and I believe they've analyzed the data. I forgot to add the numbers, and I don't want to speak inaccurately, but a few hundred doses have already been given. and they've already kind of outlined how they're going to go. Problem I think they're up against is a lot of nursing homes, again, are having outbreaks, and that's where you can't go and give the vaccine because you can't give it to a person actively either having an illness or quarantining. So there's some challenges in that aspect as well, but they're working, they're doing that effort, and I'll try to add the numbers as we get a little bit more clearer information on that.
Vinny, I thought that you had indicated that there was over 200 of those facilities in Tarrant County.
Yes, sir.
When I got something came out, an email came out at the end of the day yesterday that talked about the partnership with CVS and Walgreens, and when I sorted that by Tarrant County, there were only 45 different locations that were noted in Tarrant County on this deal.
I will look at that spreadsheet as well. I think we got the same spreadsheet. I'm looking at the state database where the signups happened. The last I checked, there were 278 facilities identified by DSHS, because they regulate, or HHSC regulates these facilities, and 201 definitely had signed up under the federal program. After that, I haven't gone back to look if there's been any changes. And I think I mentioned to you, there's supposed to be a Texas program as well. The details have been thin. We've asked a couple of times and haven't gotten a good answer. So we know that 201 entities signed up, that's for sure, because I saw that with my own eyes. Yes, they're signed up.
And who's administering the Texas plan?
That part, we asked and the details were not forthcoming. So we'll keep asking, and I'm sure, because we got to resolve the other 77 facilities. They can't be left alone, so we'll keep working on that. So here's the update just from what we've administered, and this is about a day and a half, maybe 2 days behind. So this was till Sunday evening, but the numbers still hold up because these are percentages. So coverage by city, as you can imagine, Fort Worth being the largest city, 40% of the people who got the vaccine ended up from Fort Worth, 9% from Arlington, 4% from North Richland Hills, and the numbers keep going lower. And these are the numbers that floated to the top. And there's, 2, 5, 10, and I'm telling you, all of North Texas, a couple of people from San Antonio, and we try to filter everything that, we can by the county. But there is a challenge. A lot of our county staff, a lot of city staff, a lot of other people who work in Tarrant County that are healthcare providers live outside of the county. So we've had to let people in with an ID badge of some sort. I work here. Okay, we're trying the best we can to limit it to Tarrant County, but, it's hard to say no as a public health entity. We know that vaccination is going to be done together. It can't be so restrictive that you're out. That's not going to work, So we're trying to manage the best we can, and generally it's working. Even in our eligible list, we looked at the data. About 15% or 10% were out of county residents. 90% were Tarrant County residents.
But
So,
Vinny, I understand,
Yes,
I
sir.
understand how hard it is to say no to someone.
yes, sir.
But when we get, and I think I've handed you, or did,
Yes, sir. I got it. Yes, sir.
and I guess what I'm saying is, we've got to make a new plan.
I'll get to that.
Because-
I have that addressed in here. Yes, sir. We'll get to that.
Well, I want you to address specifically what I'm putting on this sheet,
Yes, sir.
because
Yes, sir.
we've been talking about this for a week, and we've still got lines outside,
Yes, sir.
and that's gotta stop.
I-
It's got to stop.
Okay.
Not just, we're gonna talk about it, it's got to stop.
So let me get to that in a couple of slides, but mass vaccinations do happen with lines.
They're not gonna be outside if they're gonna be in Tarrant County.
Understood. Yes, sir. We'll get to that just in a second. So let me show this. I know there's interest in who got it. So the younger age group, 18 to 64, was 76%. But that's where a lot of our first responders are, a lot of our 1A eligible healthcare providers, nurses, doctors, all of those folks are. So that's why that group is bigger. 65 and older, 24%. Those are the straight up 1B. But even in 1B, a lot of people are in that younger age group with underlying health conditions. So that's how that number is shaking out to be. Ethnicity data, and this is where we're already starting to see outreach efforts needing to be stronger. Non-Hispanic or non-Latino, 89%. Declined to specify 6%, and Hispanic only 5%. So certainly an outreach effort that needs to be increased to get to our Hispanic community. It's got to be proportionate. In our community, I think we have upwards of 25%, maybe 30% Hispanic community. and I'm hoping that we get the numbers up there to start addressing it at least equally, if not better. Race and ethnicity data, 93% white, 4% Asian, 3% black or African American, and other races were, at least on a percentage basis, 0, but there were one or two, a few handful of folks. Again, outreach efforts are going to have to be very strong. Reverend Emerson has reached out. We're going to work with him on sort of town hall style discussions with the African American community to engage people. So there's going to be efforts underway, but that's where I need leadership to step in and start getting the word out with us that as people hear about the vaccine effort, they need to sign up so we can qualify if folks are eligible or not, and then call appropriate groups so that we can do this in an equitable fashion instead of just whoever came.
Again, I've had a number of people call in. I had one call in this morning that basically said, I registered a week ago. I got an indication when I submitted it that they'd gotten the application, but I've not heard from anybody. I had a customer that I told about it yesterday. They filled out the registration and sent it in, and they got called that afternoon for an appointment.
Yes, sir.
So how,
So
one's over, both of them were over 70.
So I have an order. So the process slides are a little bit later. So if you want, I can go there and come back, or if you want to address the challenges,
We can wait and
Yes,
come,
sir.
we
Yeah.
can wait
Yes, sir.
till later.
Can
But
we
I'm,
go back a
Yes, sir.
slide?
Yes, ma'am. So are there challenges?
No. Let's go back to the previous
Oh.
slide with the demographics.
Yes, ma'am.
It's very concerning.
It is,
I think
absolutely.
with any system, and this one is currently built on scarcity, then it makes it rife for inequality. And even though there has been a considerable interest in the vaccine, there still are a number of folks who have concerns about the vaccine, and they're not gonna jump to the front of the line. And, I mean, there are some folks who can't afford to wait 4 or 5 hours in line for a vaccine. So I want to make sure we're not grazing over this.
Yes, ma'am.
This is very concerning.
That's why I brought it to you all, because again, public health alone won't be able to do this. We need the
Sure.
leadership to rally the folks.
Sure, yes, and
Yes, ma'am.
we've had multiple conversations about it. So
Yes, ma'am.
I don't think that there's necessarily a lack of leadership here or in the community. I
Mm-hmm.
think people are waiting to be tasked with, here's how we need you to help. And Commissioner Brooks spoke to that earlier. And I think it's important, this has been a regular theme, not just with public health issues, but other things with the county, is us making sure that our messaging is translated. Right now, I don't believe that we have enough translated so that we're making sure that for folks who English is not their first language or preferred language, that they even can access the website and complete the registration. So we cannot see numbers like this again.
Absolutely. We understand. So the general information website can be translated. It's just a click of a button. It translates on its own. We're working on the registration form in multiple languages. The challenge then becomes, like, if people fill it out in other languages, sometimes we have issues absorbing the information. So we're working on that as well. As far as other informational material, video loops in multiple languages, we're working on that as well. I think my team had given me like a timeline, like this week or early next week, we'll have video loops ready to play in the Arlington site in 3 languages. And then some other locations where we might have video monitors are going to get that as well. The current resource location doesn't have video monitors, so we're trying to see if there's anything that can be wheeled in, but there's a risk of it falling over. So we're kind of working through some of those logistical challenges. So, but yes, we know, we understand, and we totally appreciate where you're coming from. We're working on it.
Vinny, one more thing. There needs to be a mechanism for people who are not electronically enabled, people who don't do internet, people whose neighborhoods are not connected, to be able to get registered in a way that does not include going to the website.
Yes, sir. There is. So as with COVID information and testing scheduling, same thing with vaccine scheduling, our hotline is available. And, you know, we have people that can speak English, Spanish, and Vietnamese. And if there are other languages, we have the translator service available that can get on the phone with us. So people have been calling. The volume has been through the roof. Yesterday alone were 3,500 calls with a lot of wait lines. And again, there's limited resources, as you understand. So if we were trying to balance, because the contact tracing calls haven't stopped. So people needing testing and contact tracing efforts, that's been blowing up our hotline, and now we've added this. So there's not an unlimited capacity. It's a balance. You know,
Okay.
we're
So we need to get to the point where we're not operating from scarcity.
yes, sir.
If we need to add resources to expand the bandwidth of the website, to expand the lines available to those who are calling in and the persons who would answer those phones. We need to eliminate barriers.
Yes, sir.
And in order to do that, we need to add resources, but in order to add resources, we need a plan.
Yes, sir. And let me get to that. So, are there challenges? Yes, absolutely. All of those things we've been facing and we've been addressing, you know, as fast as we can. And as you know, standing up resources takes a little bit of time and some planning. So, question is, well, why didn't we do this ahead of time? Well, the national and the state plan did not call for this effort. We clarified several times. There was no money for vaccination specifically. When we asked about the plans being rolled out, they were a distributed vaccination plan at every corner. Hospitals will get it, providers will get it, pharmacies will get it. There will be a glut of vaccine at every corner. So public health, you're just another provider. That was very clear in the national and state plans. We asked H1N1, we stand up mass vaccination sites. Are we expected to do that? Shoulders were shrugged. This is the national plan. This is the state plan. Everybody. So the answer was to avoid risk of COVID outbreak. We don't want large lines and large gatherings. So we're going to leverage the existing infrastructure. Organically, what's happening is, as luckily public health department here got more vaccine than a lot of other places in the state. And organically, it's turned into a mass vaccination effort. Let me explain. Our plan called for a first step of Alpha Pod for first responders only. Then the plan rolled out, it's Group 1A, and we were trying to see if healthcare workers would go to the hospitals. We worked with the state and local pharmacies to get a special deal done with Kroger Health, that they would receive vaccinations to do private providers and home health entities so we can do first responders at our Alpha Pod. We've practiced that for years. It was supposed to be a secretive location, not open to the public, no long lines. Bring your ambulance unit, bring your fire truck, and we'll do them, you know, vaccinate them as they come. That's what it was supposed to be. The delay of delivery of the vaccine and the approval of that plan going to private providers, a mad crush of doctors and their offices calling us, we're being left out. We worked with Tarrant County Medical Society to open up our Resource Connection location to those providers. Word of mouth spread on social media and other places, public can go. At the same time, governor's plan moved up 1B, which is general public, to open up at the same time, and the letter came from DSHS saying pivot between the two. We had only our private closed pod operating at that point, and the public started showing up. Can't say no. So
Yes,
we had
you
to,
can.
well,
Yes, you can.
no, sir, that
If
was,
you tell 200 people to show up on a Friday, and they show up and they don't get their shots because you've let 400 people get ahead of them, then
no, that's not happening. So that is not
yes,
happening.
it is.
Well, let me explain what is happening. So what was happening during the holiday week is when we started giving out the first responder shots. We called 700 people, 300 show up because they're on holiday. And then the public starts to show up, and we have a clear directive from DSHS. Don't sit on the vaccine. Pivot between 1A and 1B. If there's eligible at your door, don't turn them away. That's when we, without appointment, allowed them. It was not that we called them at that time. That's when we allowed them to, come and get the vaccine, to fill those unfilled spots, because the show rate was very poor because it was the holidays. So as the holiday weekend went by, we got more registration data and we started calling people. Their show rate was poor. We were getting anywhere between 25 to 30% no-shows and other people showing up. So we took them for a little bit, and then what we did was we expanded our call out. So if I'm gonna vaccinate 100 people, we started calling 125 people, and that worked for a couple of days. And then when uninvited people showed up, we started to send them back. You were not invited, you go back, we'll call you when your number is up. So then, yesterday, the weather was nice. So we called our max capacity, and they showed up because the weather was nice. And people who missed during the New Year holiday and all that kind of stuff, they showed up because they missed their appointments. So that's how it has been. And again, this is a organically growing mass vaccination plan, not something that we had originally wanted to do. And weather has been a challenge, we understand. But again, we're in the process of finding new sites. I think Mr. Manius has got a final sort of draft of a location that has covered parking. You're aware of that. And thank you for helping us find that location, by the way. And so we're ready to move on to that location and temporarily maybe, find a different plan for resource and do something different with it. But I want to address these folks. I know you've gotten feedback.
Vinny, you're sitting here describing something that I'm not sure exists. I can't tell you how many phone calls I get from people who said, well, I showed up at 10 o'clock when my appointment was. I ended up getting in a mile-long line. Nobody came back and asked me if I had an appointment. The people in front of me were from other counties, or Bud Kennedy's tweets out yesterday at 7:30, y'all come. If you've got an appointment today, y'all come. Somebody should have gone through the line and said, it's 8 o'clock. If you had an 8 o'clock appointment, you come to the front.
Well, you're welcome to come there, sir. Our staff walk up and down all day long carrying their phones and iPads and checking people's appointments. We go all the way to the end of the line. I've gotten the same feedback from city partners saying, well, can we come help you? Yes, you can, because my staff are tired of getting cussed out, quite honestly, because when you tell people you don't have an appointment, they start, giving us names. Which
well,
is
we can call those names every Tuesday.
Yes, sir.
Just wait a few minutes and they'll be up here.
Yes, sir.
So get a tough skin.
Yes, sir.
And tell the
what
people who don't have an appointment, you got to go to the back of the line.
Well, we're sending them home because there's not enough vaccine. So just so that you know.
Well, you're saying you're sending them home,
Yes, sir.
but that's not what I'm hearing.
People are giving you stories from when we didn't do that during the holiday
That was
week. 'Cause there
yesterday.
was, well, I'm telling you, because I talk to staff several times a day, and I've been there on the site. I've helped send people home because they didn't have an appointment.
Here's what I want to recommend that we begin doing. And I know what you've said before about weather, but I don't want citizens standing in line outside in the uncovered outside area when it's 50 degrees or when it's raining.
Understood. So,
Well, now you say you understand it, but for the last week, it's continued to go on.
okay.
So I want to move past the understanding to the point of where you're not going to do it.
Yes, sir, but we can't cancel all these appointments.
Yes, you can.
So the throughput will be just a couple hundred a day. So there's a balance. This is, again, mass vaccinations don't
want
happen.
them standing outside.
Understood. Yes, sir. Yes, sir.
I have a question for you, not related to the lines, but related to the first responders and anyone else who, well, I guess first responders that were in the 1A category. What percentage of our first responders in Tarrant County have been vaccinated? Do we have a rough number?
I'll ask the staff to get us
Okay.
some data. I know that we have more data on how many actually registered. It's a little hard because the data coming from the state is what I was able to show you, and that doesn't capture that. So we'll do a little bit of analysis of our own information and get you some some of that.
Well, and then to the judge's point is, obviously, we get the complaints. I mean, I think all of us up here have just been inundated with calls and have not been able to answer questions, at least I have not been able to answer questions to the satisfaction of the people who I represent, which I understand that, you know, with much of COVID has been hurry up and wait. That's asking a lot of our community. We are asking them to do a lot, and then once the vaccine presents itself, then they're still waiting. And, you know, obviously, it's gonna be a process, but, and so I get that perhaps what's come to us has been the complaints rather than what has worked well, but it's been significant. I mean,
Absolutely.
And we just, and
We
I
heard that
understand
as
that you
well.
all are working on a plan.
Yes, ma'am.
I want to hear about what we're going to do moving from today forward, and also incorporating what some, you know, the judge's suggestions to make sure that we don't create more problems by
Absolutely.
having people waiting in line.
Yes.
So let me help a little bit on this. I'm sorry, Commissioner.
Can I say something? And I may be going to
Absolutely.
where you're going. You know, this is an 800-pound elephant in the room. This is the 2 million people that we have here in Tarrant County that are going to be needing this. We know we have inadequate facilities to handle this. We also have heard that we are dealing with a number of other entities and facilities that we may be able to utilize very soon. I don't know what very soon is. Is very soon Friday, a week from Friday? Is it? I would like to hear what those facilities are,
Yes, sir.
where they are, and when we can utilize them. And do you have the personnel to man them?
Let me get to that.
Okay.
Yes, sir.
So that's the kind, and I think all this is great, but this probably doesn't, you snap your fingers and that happens.
No,
I kind of doubt that.
that is
But
correct.
that's the goal, that's where we need to be, and I don't want us to stop the process today until we get to that point, or only do 200 or 300 a day. But I think that I'd like to hear what we're planning on utilizing, what is the opportunity out there, and whether we realistically can get these facilities to utilize.
Yes, sir. So, go ahead.
Let me just take a step
Yes.
back and exhale, okay? So let's talk a little bit about where we are and where we're going, okay? Because that's what you want to hear. Judge Wood, we understand what you're saying, okay?
Well, we'll see in a minute.
We understand what you're saying, and it's not going to be a one-day deal, but it's going to be a goal that we're going to work to and get there as quickly as we can.
So my only
Okay,
question,
so-
and I'll let you go on, but my one question is this. Tomorrow morning, if we wake up at 6 a.m. and it's raining and 50 degrees outside, are we gonna have people lined up out in front of Resource Connection?
Probably so, if we get
Then I'm
shots.
gonna make a motion in a few minutes that we will close the site at that point in time.
At the site being closed, sir, there were 75 people in line, despite
Well,
being
they'll stand there and
communicated.
they'll pretty quickly
Yes, sir.
realize when the door is
Just
locked
stand
that they're
back.
not gonna
Just
get in.
stand back. Okay. Okay, you know, and we will do whatever the court, as a majority, tells us to do.
Well, that's the reason I hadn't brought it up before then.
I understand, Judge. So, I do have some comments for the court, so.
Go right ahead.
Okay. First of all, we understand this, okay? We don't need to talk about how bad it is because we see it every day. And in fact, personally, I walked those lines at Resource Connection twice yesterday. I went out there and I walked the whole thing, and it was long. There was social distancing, but it was long. I didn't hear a lot of complaints about it because they were very happy that they were going to get their shots. There are going to be people who complain, and that's just life. So this is how we want to move forward. First of all, Resource Connection was set up to be an alpha pod, and it was set up only for first responders, but that went out the window, not because of anything that we did, it was because of what the governor did and opening up to 1B. So this is our suggestion, and this is how we've been moving forward. We're working currently with the city of Fort Worth to set up a different alpha pod. That means that first responders don't have to stand in line, don't have to be part of that mile-long line to get their shot. They can go there, they can get that, one of the first day or twos that we had at the Resource Connection, and I was out there and I watched them, it went very well. Second of all, the judge is absolutely right. We shouldn't have people standing in line when the weather is bad. We may not be talking about this as much if it would be like it was yesterday, because we've had some cold days. We all know it's January. It's January. So we reached out to the city of Hurst because of their convention center. And the reason we like that facility, first of all, it's large. Second of all, it has underground parking that can hold 1,500 people, so it gets them out of the elements. The way it's structured is that you can have wraparounds so that you can get people into the buildings also. There may be some minor issues about getting people up and down the elevators. We're going to work that out, okay? So we first began working on this yesterday. We talked with the city manager. We started working on it on December 31st. There was no one at the city that we could talk to. We first started talking with the manager yesterday, which is Monday. We already have a draft ILA that we put together in less than a day and talked about pricing, and emergency management has reached out to the northeast sector of the county, the fire departments, because we can use EMTs, we can use paramedics to give the shots, just like Fort Worth Fire is giving the shots at the Resource Connection. And we believe that, and that's out of a possible 100 people needed to operate the site, that's about 15 to 20 people, okay? Yesterday, I authorized Vinny to go to our temporary agency and get 100 people. 100 more people than we have right now so that we can staff that site. If we have to, we can diminish what we're doing at Resource and move them out to northeast to get that site going. I don't like to close that down. I talked with the city manager this morning of Fort Worth, and I know there were some conversations about Wilkerson Grinds. Vinny's people have been talking, that's not a city facility, that's a school district facility. You've been working with them to see if we can get them. That would be a great alternate to Resource Connection because you can put the people inside the building. And if we can get that, then we're going to stand that up also. What we'd like to do is try to stand up a major site at least once a week. We can maybe set up 2, depends. There's more than just having a site available. There's several different things. First of all, the one thing that everyone needs to realize, while we show that we've done with City of Arlington, who's doing a great job, by the way, about 12,000 shots, the supply is still limited. So you need to make sure that you have enough vaccine when you open these sites up and you don't open them up for one day and then have to shut them down because you don't have any vaccine. It's a supply and demand issue. Second of all, the issue that if you go down to Resource Connection and actually walk around that site, you're going to see that those other 80 people, that they're involved in a lot of different activities. We met yesterday with budget and public health to activate. We have at least 200 laptops, brand new laptops now that we're loading up with the software so that we can operate those centers. We're trying to get that backfill administrative technology in there so that we can go ahead and run those centers. So we're moving forward in that. We're not going to get this unless the court says to shut it down. If it's 50 degrees tomorrow, we're probably going to keep Resource open. We'll check. We're going to manage those lines as we have been managing them, but we're going to move toward what the judge is recommending. And if that's the direction of the court, that we close it down if it's 50 degrees or more, then we'll close it down.
So here's my question. When is Hurst going to open?
Well, Judge, I'll tell you what. In less than a day, we put the ILA together. I talked to the city manager yesterday. We've already contacted the other city managers in the northeastern part. We're going to move as quickly as possible. Hopefully, we can maybe do something by the end of this week or the first part of next week.
So that by Friday or Monday?
At the end of this week is Friday. First part of next week is not going to be Monday, probably Tuesday or Wednesday. We're moving as quickly as we possibly can.
What about
It's not
Grimes
just,
and
it's
what
ju-
about
it-
the
it's
Alpha
not
Pop?
just the matter of having a facility. It's making sure that we have the manpower to put in there to
Let's-
operate the facility.
Let's take a deep breath.
Okay, well, just a
Let's
second.
take a deep breath.
Roy, I'll be glad to take a deep breath, but I want to finish my questions. I did not interrupt you.
Go ahead.
Again, when they're waiting in line out at the Resource Connection, where do they go to the restroom?
So we have restrooms available in the building.
You let them in the building.
Yes, sir. And we have agreements or conversations happening with facilities to put porta potties available at that Resource Connection. Again, this is happening organically, was not by design. And the other thing, I know when the weather is bad, but you have to look at all the comments. There's people who are complaining. Those folks were happy. They said, we're just glad that we could get here, get the vaccine. We understand the rain. Yesterday, we hit the top post on Nextdoor with mostly positive comments. People were just happy how well it was organized despite the long line. So there's feedback both ways. The other thing, why, mass vaccinations happen with lines, because you can't have a lot of people indoors. There's active COVID outbreak. Gets to policy measures. There are countries that have suppressed their COVID outbreak to start mass vaccination. Our national policy has not allowed that. So there's a lot to balance. When we get a lot of people indoor, it's going to slow things down significantly.
What
Those
do you
numbers.
object to on this?
I've read that, sir. Yes, sir.
I didn't ask that. I said, what do you object to on this?
It's just going to slow down the throughput to something that we can't finish the vaccination efforts in a timely fashion. If we do it the way that everybody's indoor, it's a granular appointment, because we've heard those comments, that why I'm getting a block appointment. And if we do a granular like a doctor's office, then the speed slows down. It goes back to what the national plan calls for. Don't do mass vaccines, a distributed effort. You've been in those conversations where the staff or the folks that were supposed to be relied on are calling uncle. They don't have the resources to do it.
But how many vaccines do you do an hour right now?
So the capacity is about 155 to 165. That's what we've been doing.
An hour?
And we're trying to get up to about 250
An hour?
at a bigger space. Yes, sir.
Okay.
Yes, sir.
So that would be basically, you would need to hold that many people inside of the facility.
Currently, that facility doesn't have it, yes, but the Hearst Convention Center should be able to hold that.
And
yes.
see, that's what I guess I'm getting to, is that, yes, we set that one up as an alpha pod that would have had far fewer people coming in. But it has gotten out of control there. And I believe that we either need to convert it back to an alpha pod, we need to close it down, and if that means for 2 days, we don't have a place like that until, I had understood that Fort Worth Fire said that they could open up the Bowling Center by
Yes.
Thursday.
Yes, sir. So the goal is to do a pilot run on Wednesday, and then they're going to do 2 days live on Thursday. So we're working with them very closely. The original plan, the discussion was they were going to find us a public site. When they went and looked, at least at their staff level, they ran into some issues. They came back with a Bolin solution. We'll take the first responder traffic and get it to a secure facility. We worked with that. So that's one site that's going to offload some traffic from here.
And then if we could open a Hearst,
The goal is to have Hearst Convention Center ready by this weekend, hopefully, and go live sometimes next week. There's a lot to pull together. It will be easier if you all agree that we can close the Resource Connection and move everything there till we find a good plan.
well, I don't
That's
think,
like one of the only locations that has bus access, right? I mean, we're still relying upon, relying upon the fact that people are gonna have a car to get to the vaccine, and they just don't.
that's where
So-
Grimes comes in.
Sure, but, until Grimes,
But-
right?
Yes. So
Again,
there is
you're-
locations on the bus line.
The problem that we've got is that all of this, as Finney said, is growing organically. We're in a reactive mode, and we're not gonna get where we need to go in a reactive mode.
So
We need a plan, and Hearst Convention Center, while it will serve Northeast Tarrant County, is not gonna do anything for the fact that we've only got 3% of African Americans
Understood.
vaccinated and 5% of Hispanics vaccinated. We need a plan that is going to address this holistically.
Yes, sir.
And stop just reacting to every emergency that comes up.
So the only reaction that's happening is that we're activating our mass vaccination plan. We've done this in the past. We know how to do this. Only problem here was the national and state plan did not call for that. It called for a distributed
I
vaccine
get
access.
all that, Denny.
Yes, sir.
But we need to, if we need to bring in an organization that can pull together a plan while we deal with the day-to-day activities of giving shots, then we need to do that.
Yes, sir, we are doing that. So let me explain. So,
Fort Worth
wait,
is
no.
working with
Wait.
Williamson Grimes.
So Commissioner Brooks, we understand what you're saying, and we need the plan. I think it has to run parallel with what we're doing now. We have to develop the plan, but we can't stop doing what we're doing now.
That's right. So if we need to bring in somebody to help us develop a plan,
So,
let's do that.
okay, so
Yes, sir.
let's talk a little bit about Wilkerson Grimes. Have you had conversations
So-
with the city? Not with, I'm sorry, not the
So
city.
Fort Worth wanted to take the lead on finding facilities in Fort Worth, so they're doing that. We've had conversations about Wilkerson Grimes and the Coliseum, or the Will Rogers Arena, sorry, no, I kind of mixed up the names, the Will Rogers Arena. So those two facilities are in play, they're checking on it, but they wanted to stand up the Alpha Pod first. We've had conversations with MedStar, who's been a helper. With our help, they got approved as a site. I heard you talk about a need to get out into the community, do mobile clinic vaccinations. We have it as part of our plan. Commissioner, we have a plan. It's part of our plan. But when mass vaccination efforts kick up and the public's coming to you, it's hard for us to pull out of that and get mobile. We have to kind of let this sort of simmer down when we get access. I've asked MedStar to start helping. As they kind of work out the kinks in their system and they start to receive vaccine, they are considering that and taking the plan mobile. So they're going to be our helper out in the community to get mobile, stand outside, let's say a senior center, independent living, and run a mini clinic there. So there's a lot of moving parts that we're working with many partners on. As Mr. Mania said, we have Northeast Fire Department Association, 14 cities, and their city departments and the city managers willing to help. We're working with them to stand up the Northeast location. We are debating, now that the location has become public for the resource connection, you can't put the genie back in the bottle. We're trying to take maybe a few steps back and come back with a revised option for that. Maybe a lower volume facility, have the appropriate arrangement for people to not have to stand in the elements. But it's going to take us a few days to not have that facility operational because it's hard to reconfigure it when there's hundreds of people lining up. So that's why we said maybe if we can do everything at the Hearst Convention Center for a few days and come back to it in a repackaged deal, then we can use that facility or we go elsewhere.
The
'Cause-
Hearst Convention Center is not accessible to the people I serve.
Yes, sir. We'll present something else to you then.
We have asked for, Fort Worth is pushing forward, I think, with Grimes as quickly as they can. And I hope that it would be by the end of this week or the very first part of next week. And that would be a facility where people could stay inside. They would have indoor facilities, not porta potties. And we could do that. And you're right, that is on a bus route. I think we're talking about, and the staff is working on trying to get this done, but what I'm just saying is we are using the resource connection for a purpose other than what it is capable of fulfilling, and we're putting folks at risk not only of the weather, also of just standing in line. I've had also a number of people who had appointments who got up and saw the mile-long line and said, I can't physically stand in line for that period of time. So if Resource Connection does not allow for people to be indoors and wait, then we need to go ahead and stop letting that be a 1B facility and let it continue to be the alpha that we have, and tell those folks that are 1B qualified, give us a couple of days, we'll either have Williamson Grimes set up, Wilkinson Grimes, and then for those folks in other places, I mean, we got people coming in from all over the region that we're seeing at Resource Connection.
I'm not going to agree to shut down the Resource Connection until there is an alternative that can be stood up at the same time. The Resource Connection may be inadequate, but it's better than nothing.
So you're gonna have people standing outside in the rain.
That's a choice that people make.
Well, no, because they're supposed to have an appointment that we've told them to come. It's not supposed to be a choice. That's the other part of the problem. We've allowed it to be a choice that they can make versus you've got an appointment, show up, and everybody else stay away.
Well, I
The
think that's one of the
operational
keys.
details of the Resource Connection are something that we can tinker with. Shutting it down so that there is not an option in that community is not something we can tinker with.
Well, I mean, and really, it serves the whole southern portion of the county.
We're not gonna shut Resource Connection down until we have something like Wilkerson Grimes to stand up, which is just basically
You're
across the
darn
street.
right we're not.
Well,
So can we not put up tents? I mean, just like, things that we utilize during voting and all of that, can we not put up tents along the line?
So again, I don't want to keep elongating the operational details, but we have tents out there. It's not going to cover miles that, lines that are very long. It's supposedly a mile, but you know what I mean.
Yeah.
They're very long lines. We've had heaters out there. We've had a fast track line. Anybody in uniform gets pulled out, anybody with a walker, cane, wheelchair. When we go and check are you here for an appointment, we check their age. If they're in the senior category, we pull them into the fast track line. Fast track line moves twice the pace as the regular line. So we've done a lot of operational
Sure.
things.
Well, and I want to
Again,
be clear, I'm not questioning the efforts that you all have put in place, and I know that obviously that unfortunately we are reacting. And as I said a few weeks ago with the first vaccinations that were given to first responders, is that we were ready to respond. And obviously the situation has changed, which means that we have to reevaluate and pivot. I think what's important, though, is that we have not done a good job in managing the expectations of our residents so that they come prepared and know what to expect. Now, I get, that by and large, that there haven't been a lot of complaints maybe that have been communicated to you or your team, but they've certainly been communicated to me and to my colleagues, right? And that's just the nature of the game sometimes. But, I get that you're saying that we have a plan, and I guess your next slide.
It kind of goes over the process, explains some of the things. So what we're doing is combining our efforts and finding some willing partners. Not everybody's willing, but a lot of partners are willing to do a combined single entry registration. So as you all have heard, we've had tarrantcounty.com/COVID shot as the entry screen. 160,000 people registered, 136,000 currently eligible. Total number of vaccines that we've received so far is 12,000. We've given out close to 8,500. So 3,500 vaccines available for close to 130,000 eligible people. So what is the process? You register. And after that, originally, we were sending out an automated email. But as the registration volume kicked up, we got alerts from Microsoft that you're exceeding the daily allowed volume. IT called saying you're going to get Tarrant County blasted as a domain name that is blacklisted by Microsoft. Shut this automation down. So we did. So we took a different route. We have an automated calling system. So at the end of the day, every morning, we take all of the people, 10,000, 20,000 who've registered, they get an automated call. Thank you for signing up. There's limited vaccine and a lot of eligible people. It may be a while before your number comes. We will contact you with the next step. If they don't respond, they get a text message and a voicemail. with all that currently you're only signed up. And if you want, you can even express your further interest by pressing 1. Some people do, some don't, but we have them in our list. So then, let's say several days go by, 2, 3, 4 days go by, and their number does come up. And by that time, we've analyzed the data, who's eligible, who's not, who's in county, who's out of county, who's in what category, are they critical infrastructure, whatever information's come in, we've analyzed it. So all the people are in different buckets. And we have been pivoting between 1A and 1B as the Texas plan called for. Currently, we're supposed to be only in 1A. They changed the plan on us right before Christmas, saying 1B is open and go back and forth and try to do them both. So then they get an automated call saying your appointment number is up. You have an appointment tomorrow at Resource Connection at 9 a.m. or between 9 a.m. and 10 a.m. But if you can't make it at that time, because we understand people can't drop everything and get there, come anytime during that day, okay? So that's and so what we're expanding that to is now Arlington's willing to take from that bucket, so they've gotten rid of all their pre-registration process because they were facing the same issues. We've talked to MedStar, they're willing to do that once they start getting vaccine. Fort Worth sites are gonna follow the same process, and we're hoping that different hospital partners, different pharmacy partners, others join the effort so we're eating away from the same registration pot instead of everybody having to register separately. But again, everybody has a different process. They have the choice either to follow that or not follow that. So that's how it's currently working. And when they get that second call that your appointment is up, you're welcome to come, we send them also a link for where they can go fill out a consent form. We, at least in our process, we send them an actual appointment registration form where they put in their emergency contacts and all those details. And so that's how it's supposed to work. What is the confusion that's happening? People sign up and then they show up on site. That is true. We've turned away hundreds of people. Well, I signed up. I heard that it was here. They're standing in line signing up. So we're sending them back. Then second confusion. A lot of seniors, they get the message, and others too, they just get the message acknowledging that you have signed up and we will call you when their number is there. And we've had people show up. Well, I got this message to show up. No, we just acknowledged you're not on the appointment list. And so that's been a lot of confusion. Your office got those, my office got those. Well, I got a message, I didn't hear the whole thing, but where am I supposed to go? Well, we just acknowledged that you signed up. So that people were calling all day, every day. Well, I don't know if I got registered because, they didn't see the screen saying it's saved. So we're trying to work through all of those things. These opportunities here, let the public see what the process is like. And we will continue to educate the public. Again, only 3.5 doses on hand with 130,000 eligible. So it's gonna take a while and patience to get everybody through, like you heard. Some people signed up and they're waiting. And I get those calls all day. Where am I in the queue? We're starting to pre-book appointment to our capacity. So in our system, we can see next couple of days who we're gonna invite. But further than that, it's dependent on vaccine eligibility, dependent on where the location's going to be. So there's a lot of moving parts. So I just ask that everybody be patient. Again, this is not a slant to anybody, but throughout the pandemic, everybody has become the expert to tell public health what should be done. Please, everybody understand, public health is the expert. We know, we have done this many, many times. We just need some time and patience with everybody to work through this. Again, the national plan and the state plan did not call for this. And when the vaccine came, well, public health, you know how to do this. Let's get this done, and at a very fast pace. We get it. We will make it happen, and there's a lot of partners willing to help, but it just takes a little bit of time to put the operation together. As you know, staffing resources are currently, working on the outbreak. If we move away from there, we got other problems. So we got to hire new resources. There's city partners who are willing to help us with the resources. It just takes time to assemble an army, and that's all we're asking, just a little bit of patience on everybody's part so we can get this done right. Final comment, we absolutely hear what you're saying. We're finding locations that have covered parking. Our existing mass vaccination plans had school stadiums and indoor facilities with seating, but there's a COVID risk and they don't have covered parking, so we're finding new locations. So there's a little bit of wrinkle with COVID being around. So there's a lot of things that we're doing, and the team's working real hard, not just us, a lot of our city partners. So just give us a little bit, we'll come up with a better plan. And trust me, there's a lot of positive feedback coming too. There's people who complain, but there's more that have given us positive feedback, and I hear that as well. So please just let us work on a plan, and we'll come back to you with a little bit more clear plan on how we're gonna do this.
Okay, so here are two complaints that I've gotten from quite a few people. One is, there's perception, there's reality, but the perception right now is that the system that's set up is to favor some over others. And there's a lot to that, right? But we have to be able to manage that. Two is, I've heard from quite a few folks who did get the first round vaccine, and now they're concerned because they either through their experience in getting the first round vaccine or what they're hearing from others, now they're concerned that there isn't an organized mechanism for them to get the second round. So speak to that, please.
Yes, ma'am, there is. So our systems have the automated calling ability. When their second dose comes up, they get an automatic call. So here's the other, again, I hate to get into operational details because this is not the venue, but issue is you call people. We did 2,000, let's say, on one day. Their 2,000 doses are up on 28 days. We call them. Not everybody shows up. So you got to give them time because the government or the Moderna guidelines allow up to 4 days. So you got to give them time to show up. That's going to create backlogs and traffic jams. And then people go everywhere. So we're educating them, and we're giving them the CDC card with Moderna clearly written what lot number. So if they show up at a pharmacy by then, or they're in another city and they go up to a public location there, they can show their card, and we're educating them, ask for the Moderna vaccine. If that was not complicated enough, other countries, England, for example, has tried to fast track. They're saying only get one dose to everybody, let's worry about the second dose later. They're allowing mixing and matching of vaccine on the second dose. Our national policy currently states 2 doses must be given, must be the same vaccine. There's a lot of discussion up top if that's going to change. So again, a lot of moving parts with this pandemic. You all have been familiar with it. It's fly by the seat of your pants on a lot of these things, and we're just rolling with it. So again, I don't want to belabor the point. We'll come back with a revised plan. Mr. Manias has been helpful. Our team has come up with a lot of options. But as Commissioner Fick has said, there are limited resources. We're going to have to raise a lot of resources, whether it's ours or city partners helping. It's just going to take a little while, and that's okay because the vaccine is very limited. The point I want everybody to remember, we are the North Texas leader who got the vaccine out very fast. So we know how to do this. A lot of places don't have what we are doing. I'm getting calls from all over the state. How are you guys doing this? So there's a lot of positive feedback and a lot of just, how are you doing this? Because we are getting it done. So I want you to remember that positive message as well. I know you get a lot of feedback like this is not good, but there's a lot of good happening here as well.
Let me just comment that nothing I have said this morning is a criticism
Oh, yes, sir, I understand.
of Tarrant County Public Health Department. I think we've got the finest public health department in the nation. I think your leadership of that department has led to the fact that we are recognized as the organization that got the shots out there the quickest and to the most number of folks. My suggestion
Yes, sir.
is that public health is so in the weeds dealing with trying to get the shots out there, trying to manage the demand and the limited supply, that you don't have the bandwidth to plan. And I continue to say that in order to be successful going forward and to immunize Tarrant County, we can't do that without a global, holistic plan. You say you're working on it. I don't know how you have the resources to do that. What I would be asking this court to do is to provide resources for planning.
Yes, sir. We'll be happy to take, and we're very appreciative for your support. And like I said, we'll work with Mr. Manius's office. We'll come back and ask for whatever resources we need. And we, again, thank you. Your feedback is well taken. I don't take this as criticism. You all are the leaders holding us, our feet to the fire. So we get it. So we'll get it done. Yes, thank you. Any other questions or comments on any of the other information?
I mean, I'm
Yes, sir.
still at the point to where if you're saying you're not gonna close the resource connection, you made the statement. And what I'm saying is then at a minimum, we're gonna have tents out there, and we're gonna have heaters out there for the entire line, and we're gonna have porta potties out there.
So we delivered 20 porta potties this morning out there. And we do have tents for at least, it looks like about 50 yards to me,
Yes, sir.
before you get into the door. I've saw
Are they
those tents.
tarps or are they tents?
They're
Tents.
tents. They cover the sidewalks.
Yeah. They don't have sides because we can't have, we need airflow because COVID is still a risk.
What I meant by closing resource, we've heard what you said. We need to have an alternate that's on a bus line. If we get Wilkerson Rhyme set up, well, then we need to reevaluate closing resource, because resource has its restrictions. You know, it's functioning, quite frankly, it's functioned pretty well. We've been giving about 1,300 shots a day.
Is there any problem with you basically saying don't show up until 30 minutes before your appointment?
Well, so, yes, sir. So we have signage that's in the print shop. I think it's going today. If you want, I can share this with you. There's
Let me have it. I'll
Yes,
share
sir.
it with them.
There's 4 different kinds. 2 in the back address very clearly, no appointment, don't come back later, and I'm paraphrasing. And the 2 in the front actually talk about timeline, because people ask how much longer. So we've kind of estimated how much longer to a certain spot. And again, that was again to address the current plan. Mass vaccinations always have lines, so we have there, you have 1 hour, you have 2 hours, because again, it just takes a little bit to get all the people done.
So are you telling people to show up at their appointment times or whenever they want?
So if somebody has no appointment, they're being sent back. We're inviting people on an hourly block. Your appointment's 9 to 10, 10 to 11, show up then. What we're giving flexibility is, let's say, I think you got a call the other day, 10 a.m., show up to get the vaccination. Well, you're gonna be in Commissioner's Court, you can't drop that and run and get the vaccination, so we're allowing flexibility, show up all day that day. So what has happened, people have missed their day because life happens. I was away, I had something else. If they show up the following day, so far, we've been accommodating them. But I'm hearing from a lot of people that they're starting to cut that out. In our view, in the public health view, that's a little unfair because we only gave them 1 opportunity to get vaccinated. So if you would let us kind of work that, we can try to load balance the days on how to manage that. And if it doesn't work, we'll cut that out. But we're trying not to send people away that are clearly eligible, just couldn't make it on the time that we assign them.
Well, I mean, that goes against the basic tenets of public health, which I
Yes, ma'am.
understand that. But again, it goes to my point about managing expectations, which I would love to communicate out to my constituents what they can expect. But honestly, I'm just learning this now.
Yes, ma'am.
So in addition to this, whatever else to, some boilerplate stuff that we can send out.
We will.
And so that with each community leader that calls me, each constituent that my staff talks to, then we can be reiterating, here's what you can expect for right now. I think that would do a lot to calm down some of the confusion, and then some of the anxiety just associated with the whole process. Because folks are very anxious
Sure,
about
they
it,
are.
whether they're in line to get it, or in the queue, or they don't even know what to do with the URL,
Yes, ma'am.
Benny,
Yes, sir.
I think, I just want to be sure, I had a gentleman call me yesterday, and he's actually signed up to speak today, and I don't want to take away everything he's going to say, but I think he had an appointment, I want to say at 11 o'clock, showed up, was told it'd be a 5-hour wait, was then told that we're not going to be here in 5 hours, so you're not going to get a shot. And he had an 11 o'clock appointment. He goes home. You know, what else is he going to do? So I'll let him tell, if he's, no, I think he's here. I'll let him tell the rest of his story, but I just want to see that kind of stuff not happen.
Understood.
Okay.
And we're working on it. So perfect example yesterday, we had to cut off the line. So we knew there were people backing up at 1 o'clock where we won't be done. We auto-called everybody that had an appointment to 1 and 3. If you're standing in line at the resource connection, we have overcapacity, so you can leave, and we have priority hours for you the following day. So today in the morning, 9 to 11, only those people that missed their appointment are being called. After 11, rest of the new appointments start. So there's a lot being done. Again, you know, this is not the platform for operational details, but we know how to do this. We just need a little bit of time.
It's not the place for operational details until those details aren't working.
Yes, sir, I understand.
And then we're the ones that get the calls. And so if you knew at 1 o'clock that you didn't have enough, how is it that you know how many shots you can give an hour, and you set up those number of appointments, then how is it that you don't get through those appointments?
So, like I explained, over the last week, with the holiday and the weather, we were getting 25 to 30% no-show. So we've been overbooking ourselves to get to 100%, because the goal is to get the vaccine out fast. And yesterday the weather was nice, and the holiday, holiday mood was gone, right? So everybody showed up, people who had their appointment, people who missed the appointment, and of course we called more people than what our capacity was. And then the regular 50 or so or 75 or so that show up without an appointment, those folks were sent home. And then we realized in the afternoon, well, there are too many people and not enough time to get them all done. So we started to weed them out. Some people agreed, some didn't. And so we got done what everybody was there, and at the end of the day, we had sent 100 people home. Now, there were people who left, and we saw that because they acknowledged the message. So this morning, around 300 people were invited between 9 and 11 that had missed their appointment. And after that, the regular day starts. So there's things that we're managing on a day-to-day basis. Constant feedback I get is, well, there are people in line that are out of county. Well, yes, because there's a lot of city county workers, a lot of first responders, a lot of doctors that live outside of the county. We are inviting people that are qualified under those categories. And, you know, some of that is honor system. I mean, have other people snuck in through? Yes, you know.
So look, so I think we've fully
I
heard
do,
what.
I have a policy question. So with the directive that we got from Dishes to combine 1A and 1B, or to pivot in between, is that a shall or a may?
You shall. They have been very terse. And some of the frustration was in their data, that is not accurate. They're seeing a lot of vaccines sitting around. So then they sent it to all providers. It wasn't just directed to public health. All providers, hospitals, private doctors, pharmacies, whoever got it. Everybody's supposed to do this. So if we eat away at the distributed plan, this will not become an issue for very long. There's limited supply, and there are a lot of partners that are not, at this point, doing what we're able to do.
Sure.
Because their concern are their facilities are going to get overrun. And that's adding extra burden onto us.
It is. I mean, my main concern is making sure that those who are the most vulnerable are actually getting the vaccine. And I know obviously there's part of the system, you know, from the back end that you all are making those determinations and then also going upon the honor system. But I am concerned if our first responders don't have access to the vaccine, when obviously they are risking their lives every day to care for all of us, including those with COVID. So that's why I want to make sure that I understood really where that
So the plan called for 1A, which included first responders. 1B opened up and it cluttered it a little bit. We are getting 1A or, well, mostly first responders pulled into a alpha pod separately. Because
Yeah.
we understand they can't stand in line for this long because they have calls that come, they gotta go.
Exactly.
We understand that, yes, ma'am.
Yeah.
I
Okay.
hope that as we get into the 1B, that we'll also find a way to filter teachers.
So that's already happening. If they're in 1B and they're teachers, they're already getting immunized. So we are doing anybody that's 1B eligible, because I get calls, well, I'm in a Texas National Guard. Do I have special access? Well, if you're in 1A or 1B, yes. Otherwise, I have reached all the way up to the SHS, the EVAP committee, and asked them to evaluate critical infrastructure. Federal 1B was critical infrastructure. Texas did not address that, moved to federal 1C. That has become our 1B. And that's a huge volume of people. In the 1B alone, there's 500,000 in Tarrant County.
So let me suggest something. We need to take about a 10-minute break because we have a data issue that we want to deal with so that we can continue to record this meeting. Is it okay if we take a break now and then come back to this conversation?
Yeah.
Your Honor, we're ready back there.
Do we want to wait for Vinny to get through and then?
I think he's finished with his presentation. If you all want to make more comments about it, then that's good. But
Okay, we'll go ahead and then restart. I guess the only comment in addition, I said something about having tarps and heaters. Let's have some chairs out there also for them to be able to sit down, because a number of those folks just can't stand.
So what we've done so far today, we've extended the tents to push them out even farther. I do want to correct something. I'd received a note while we were in court that we've already received the 10 porta potties. We'll receive them within 2 to 3 hours. And so we'll have those set up. And just a closing comment. We heard everything that the court talked about today. And we're going to aggressively move forward on this thing, and hopefully you'll see, we'll try to communicate better with the court members than we have on where we are and where we're trying to go. So I appreciate the support of all the members on what we're trying to accomplish. So, Your Honor, we have, at this point, we have several audience participation forms. I believe we just have a few. I think we have one call in, and there's, I think, 4 in person.
Yes, and I think the first one that I've got is Matthew Bradazzo, and then followed by Blanca, followed by Doug Hines, followed by Sherrod, and then the call will be to Don Martin, and so at this time I'll call on Matthew Bradazzo. Is he in the back room, or
Said he was coming.
or he was here earlier? Well, I say that, I'm not sure. We had this form yesterday.
Okay. Well, he was the gentleman that called me that was gonna come up and visit.
Get him up there. Let's go.
Okay, Blanca is next, and then Doug Hines, and then Sherrod Perry. So Blanca, if you'd come on down. Is anybody back there?
There's 2 people, Your Honor, but not Matthew.
Okay, I just called on Blanca and Doug Hines, and so
You ready for them?
I'm ready for them. Come on down.
Good afternoon. Thank you for having us and listening. Listening to this is like being in the twilight zone. Unbelievable, unbelievable that we have been so hoodwinked and so deceived into thinking that not only the masks, the lockdowns, but now that the vaccines actually work. What is going on? Whew, I have a handout if I can. Do I hand them to you? This is something that you'll find at LifeSite. Last week, I mentioned the different sites that verify the alternative medications to the virus or whatever it is that it is, which is more or less the same medication that they treat radioactive poisoning. But this one, doctors petitioning the EU to stop all COVID vaccine studies due to grave risks. More doctors. There's more recommendations here. I have another one here that I'll bring next week, the copies, which comes from anomaly.com, some of the recommendations that he makes. But all I can say is today that I can only pray, because it's going to take the power of God to break the deception. If we can just look at Sweden, that had no lockdown, and their numbers were about less than, very little less than, but about less than. Then you had South Dakota, which didn't have any lockdown. The same thing. The numbers are there. The evidence is there. What is going on? The same people involved with this virus, the Fauci and all them crazy folk are the same ones that were involved with the HIV virus that was then traced to the different government programs. Then we're trusting in a vaccine, for heaven's sake, that has killed so many children in Africa. So many children and people have been affected here. We don't even know the great risk that it has to the population, particularly the minority population, particularly to the senior citizens. Well, it would be a great way to relieve the Social Security, just kill them all. I don't know. But you know what? It makes me think. I think that we have to start using logic. In some counties where they had no lockdowns, where they didn't use the mask, where they're not pumping no vaccine, they have better. The people overall are in a better state of mind because they are controlling their lives. That a government should never be controlling somebody's life. The government is there by the people, for the people, not to control the people. That is communism. That is socialism. And that is not freedom. We want our freedom back in America. Thank you.
Next is Doug Hines. While he's coming forward, I would note that South Dakota has more deaths than we do, and the state's population is less than half of ours.
Judge Whitley, Commissioners, Happy New Year. In the Happy New Year timeframe here that I want to talk about, 2021, I think it's a good time to look back at 2020 and see what we did in 2020. I think there's a lot we could learn from 2020. I think we should do so. Let's look at what we tried and where we're at. Outbreak came in, roughly March, February, March. The governor got involved and started issuing these edicts, these EOs. And things have gotten, well, you've got social distancing, you've got the mask mandate, you've got the business closures that were tried, isolating people in nursing homes, isolating people in hospitals, locking people out of seeing their loved ones in hospitals, and all those things that have been done. And then see where we are right now. As 2020 closed out, we're at an all-time high, allegedly. All-time high of people testing positive, allegedly, for COVID. All-time high people deaths per week, I think, is an all-time high. So what we've learned from 2020 is what we're doing in 2020 didn't work. I don't know, there's no logical way to say it did. It didn't work. So 2020 is a great time to get it behind us. Let's see what we did. Let's see where we came out on 2020, how to work out for everybody, and what's going to happen if we don't learn from the past and do something a little different in 2021 is this whole thing is going to lose a lot of credibility. And credibility is what government is based on. When people stop believing the government, they stop following the government. And when that happens, that is not a good thing for the people, and it's not a good thing for the people's leaders. You were all elected by the people. I'm sure you all have sound minds and good hearts. And I think you all have the capability of seeing what's going on. And I'm not sure what's keeping you from doing something good to make it happen, to make it fix, to make it better. But what this commission has done throughout the year, following the governor's mandate, I understand the governor put the mask mandate in there. We put the business mandate in here for Tarrant County under you, Judge Whitley. Hasn't worked. It just hasn't worked. So let's kind of come up with a new plan. What I saw today was like, wow, hope is not a plan. I hope things get better is not a plan. Let's get a plan together that works. Let's learn from the past. Let's do something that works in the future. Therapeutics are out there. I think if we took all the vaccine money and started pouring into therapeutics, maybe do both. I'm not in favor of vaccine. I'd walk through the gates of hell before I took one. But I will tell you this, the therapeutics do work. It's been proven to be working. We should put some money behind therapeutics. We should do it on every street corner, right next to the vaccine if that's what you have to have. But the therapeutics should be out there, and I know from personal experience, in my own family, they work really well. Learn from the past. Let's get on with the future. Let's make it brighter. Thank you.
Thank you, Mr. Hines. Sherrod Perry?
Okay, well, good afternoon, everybody. All right, so like I said, I may not be coming up here too many more times because I feel like I've seen enough to know where this is headed. But last week, I made a pretty strong claim, so I wanted to come back at least this week to kind of add some support to that. Because last week, I actually came in here and told everybody that there is no virus, all right? And again, like I said, what I have here is a report. Back in November, about 20 or so scientists got together, and they looked at this PCR test, or they looked at how this PCR test sort of came onto the scene. Because back in January of 2020, all right, this PCR that they're using to detect the virus, basically, I want to tell you a few things that these scientists discovered about this PCR and about just basically they're saying that the whole way that this test is designed makes it completely worthless. And they make a few good points that I've made in this courtroom, actually. But I'm going to try to run through a few of them quickly. One thing that they point out is that the scientists there's basically two authors of this sort of PCR instruction. So again, in January of last year, they came up with the instructions on how to use a PCR to detect this virus. And the paper, the protocol, basically was published one day after being submitted. Okay, that's one flaw, is that if you publish something within one day, that means no one got to review it. So there was no peer review of this PCR protocol. And a day after that, the WHO took that protocol and ran with it. So again, that's one issue. And the journal that it was published in, which is called Eurosurveillance, it just so happens the authors of the protocol are also on the editorial board of the journal. So they literally probably approved their very own paper by working for that journal. So again, these are the kinds of things that make everything look very fraudulent, okay? But again, like I said, the test itself, as I've said in here, it's not detecting a virus anyway. It's detecting snippets or fragments of this virus sequence. So it's looking for certain RNA pieces or RNA sequences that supposedly only that virus has. But that's what, as these researchers are saying, that's not the case at all. This test is not a gold standard, as they say. It's not. It is the chance of it detecting something that's not the so-called virus is very high. And like I said, I held this book up last week. I hold it up again, The Contagion Myth. Again, The Contagion Myth. And essentially he's saying that viruses, what we call viruses, are basically byproducts of poisoned cells. So if your cell's been poisoned by radiation, if it's been poisoned by radiation or toxic air or toxic food or toxic water, or toxic emotions even by fear and stress, then, what we're calling viruses are actually what they call exosomes. So again, and one more book I'll hold up is Virus Mania, which I've started reading, but I haven't gotten too far with it. But it gives you a history of how we've been through this. We've been through this before with other viruses such as HIV, such as polio, such as swine flu, where the medical industry basically takes these and they use them to
Thank you, Mr. Perry.
to profit. So there's a long history behind all this, and we're falling for it again.
Next is Dawn Martin, and I'll call her at this time. Hello? Okay, we'll try one more time. I know. But then it didn't.
Hello.
Ms. Martin, this is Judge Whitley. It's your time on the agenda for any public comments you wish to make.
Yes, sir. Thank you. So you keep saying, do your part, wear masks and social distance. The majority of people are doing these things, and the cases and numbers continue to go up. This is the true definition of insanity. We keep doing the same thing over and over and getting the same results. Places like Dallas-Fort Worth, Houston, even cities in New York and California are seeing the rise. The cities and states with no mandates are not seeing these spikes. All we hear is fear-mongering and manipulation of data, and keep seeing the same results. What your so-called experts are telling us to do does not work, period. This is insanity, and it must stop. Your plan to vaccinate everyone will also not work because you've had months to plan, and you can't even seem to manage that. And so if you seem to want to push the vaccine like a used car salesman, we don't want it. We're over it, we're tired of the mandate, and we're asking you to, like Doug said just a few minutes ago, reconsider what you're doing and reconsider the plan and change tactics. Thank you.
Thank you. Okay, that's all of our audience participation for this week. So, Mr. Manius?
Thank you, Your Honor. Members of the court, we're going to go to the administrator section to item A1, and we're going to start. Remember, we had told you that Guidehouse was going to present to you a wrap-up of calendar year 20, and what we've done, we're ready to do that presentation. So, Rachel, are you on the line?
Yes, good afternoon, DK.
Okay, if you'll go ahead and begin.
Sure. All right, so good afternoon, Judge and Commissioners. Like DK said, today we'll be presenting a year-end report on the county's use of the CRF, or Coronavirus Relief Fund, and its activities to respond and recover from COVID-19. If we can move to the next slide, we'll get started. As you know, Congress recently extended the deadline for the use of CRF funds, so this report will only cover activities funded by CRF during calendar year 2020. We'll focus on the 4 pillars of the county's CRF programming, so that's testing, economic stimulus, social services, and local partners. So this isn't the full use of CRF funds, but these are the main programs that we're going to focus on for this report. So the county spent about $18 million on establishing and operating testing sites, yielding an average of 5,000 tests per day. County also spent about $23 million on small business assistance, providing support to about 3,000 local business owners. $14 million on social services, which yielded support to 79 NGOs and about 1,000 local renters. Note that the rental assistance program continues into 2021, so this is just a snapshot in time. The program still has a number of applications, I believe a few thousand to continue through, so there will be additional awards for eligible applicants this year. And finally, the county spent about $68 million in support of local partners, ensuring that municipalities, emergency response units, and chambers of commerce could effectively respond to COVID-19. And as you can see from the chart to the right, local partners funding represented more than half of the county's total CRF spending to date. And again, this is just spending from CRF for the 4 pillars, so excluding the county operations and things like that. Any questions on this slide before we move on? Okay, so we can move on to slide 2, and this will cover, we'll start with testing. For the county's testing program, the county leveraged state and local partnerships to maximize the amount of free COVID-19 testing available to its residents. And we'll talk more about these partnerships on the next slide. Through these efforts, the county facilitated the creation of 17 sites that provided free tests as well as at-home testing options. To ensure residents were aware of the testing options, the county pursued a wide range of strategies listed here, including using these partnerships and things like text notifications and social media notifications. As a result of this effort, more than 226,000 people were tested at these sites. And that's, as we mentioned, an average of about 5,000 tests per day. Any questions here before we move on to additional information on partnerships and testing site locations? Okay, we can move on to the next slide. The county was very intentional in its work to spread testing sites across the geography of the county with considerations to transit accessibility and making use of well-known locations in each community. This map depicts the location of testing sites as well as the current operator, some of the operators changed over time, and the average number of testing sites per day. As you can see, the largest sites were operated in partnership with PDEM, and a high number of sites were operated in partnership with the city of Fort Worth. Through these partnerships, as I mentioned, the increased number of testing sites that were available to residents. So as you'll see on the legend there to the left, the color code tells you the current site operator. The size of the circle tells you the average number of tests per day. Any questions on testing before we move on to the Small Business Assistance Program? Okay, so we can move on to the next slide. As you'll see from this program, partnerships are also instrumental to the county's Small Business Assistance Program, which awarded more than $23 million to nearly 3,000 local businesses. The partners listed here ensured that businesses were both aware of the fund and had the support they needed to complete the application. The average award for the Small Business Assistance Program was nearly $8,000. Businesses used these funds to keep employees on their payrolls, to pay their rent and utilities, and to purchase the equipment, inventory, and supplies they needed to adapt the new business environment during COVID-19. Businesses from a range of industries participated in the program, and we'll talk more about those industries and where these businesses are located on the next slide. Any questions here before we move forward? Okay, so we can move to the next slide. And you'll see that nearly 2/3 of participating businesses were minority, women, or veteran-owned. 20% were in the health and wellness industry, and 15% from food service. The map on the right here depicts the total amount of small business assistance grants that were awarded per city. And this is a filled map that follows the municipal boundaries. So the entire city boundary is filled in based on a color that reflects the awards per that city. And you'll see that legend on the left. The color corresponds to a different amount of funding total across the city. The total grant amount is, of course, a function of both the business needs and the city population. So larger municipalities are likely to have higher total fund awards. The most awards were issued in Arlington, about $8 million total. The next largest group includes Bedford, Crowley, Grapevine, Keller, Mansfield, and Northwood, Richland Hills, and South Lake. And we have a full list of the number and dollar amount of awards per city in the appendix, and we'll have a few different things in the appendix that you can refer to later, just the tables that underpin all of the maps and other kind of data that we've got in this report. We've got a couple more slides on small business. But before we move on, is there any questions on this slide?
Yeah, Rachel, I do have a question for you. The 15%, the grants that were issued to the restaurant and food service industry, I would have thought that would have been a larger number. And so I'm curious, was it just really a reflection of the number of those types of businesses that applied, or was it our criteria that maybe didn't meet the needs of, those businesses as much as we wanted them to? So I don't know if that question is more for GK or Lisa rather than Rachel, but.
So the question was, the percentage for restaurants and food service industry is somewhat smaller than we expected.
I'm surprised by that number. I would have thought that it would have been more, just given the number of those businesses. And I know that was a particular aim of our program, was to reach those folks based off of what we understood the need was.
So do we have fewer restaurants and small and food service groups that would actually apply?
These were the awards. We don't know about who applied, but they also I know that they also self-identified. So if they were doing quickly, and a lot of people just put other on that. That's why the large percentage of other actually came out. So this was just based on how the applicants answered. We didn't go back and actually change those answers.
I see.
So
we could have served more restaurant and food service industry than what this number shows.
But for the food service specifically?
No, I understand your answer. You answered it. Thank you.
And just to note that, as you all know, the businesses that we served were those that were outside the city limits of Fort Worth. So there may have been a bigger number inside the city limits of Fort Worth.
Okay. Thank you. That's all I have for this page.
And to what Lisa mentioned there, I think about 80% of responses were responses other than others. So people who did respond with a specific industry, I think about 20% responded other. And as you mentioned, these are self-reported, and this full listing of industries is available in the appendix. But it also includes a number of industries that maybe, unlike restaurants, did not have an alternative to maybe go to takeout, to something like health and beauty, where it's really in person, people coming into a salon or into a nail service or barbershop. They don't really have a takeout option for something like that. So you'll see a lot of industries like that, or folks doing maintenance coming into your homes that they really didn't have a lot of other options other than to maybe close if they didn't get the support. So
okay, that makes a lot of sense. Okay, thank you.
Great. Okay. Anything else on this slide before we move on? And we still have a couple more slides on small business. Okay, so moving on to the next slide. This one will just cover, we wanted to provide some feedback from the local business owners. Here we have 2 quotes from business owners that demonstrate how essential these funds were in order to make the adjustments that they needed to allow these businesses to stay open. The first is a quote from a business owner who needed these funds in order to relocate due to COVID-19. She experienced a big change in her partnerships and how she was able to pay her rent and would not have been able to move to this new location without the support from the county. And the second speaks to, really how invaluable the county staff were in going above and beyond to support the application process. Due to the federal requirements, there were a lot of documentations and different things that were necessary as part of this process. And for businesses that had not previously applied for this type of federal funding support, they were really unfamiliar with this process, and the county staff were so helpful to these applicants in making sure that they were able to get their information in on time and to make sure that they had everything they needed. Any questions on small business before we move on to the rental assistance program? Okay, so moving on to the rental assistance program. The county's rental assistance program remains ongoing. As I mentioned, there are about 2,600 applications that are pending review, they are being reviewed right now and being pending award in the next few months or so. So they will be awarded in 2021 for eligible applicants. But to date, the county has supported more than 1,000 residents with their overdue rent payments, and this is an award of an average of $4,000 per household, and that reflects close to 4 months of rent payments on average. The county's program acknowledged there are many different reasons for households to be struggling with rent payments, including and beyond just loss of jobs due to COVID-19. Some households had reduction in hours at work, or they lost their child care and needed to stay home, or they weren't able to go to work because of their health, or similar reasons that really reflect the wide range of challenges that people were experiencing that affected their income and ability to pay their rent. And even though, as we know, that there was an eviction moratorium, and that has since been extended a little bit by the new federal bill, but what was really important in the county's strategy to maximize their outreach was making sure that renters knew that the eviction moratorium, once it expired, the renters would be responsible for paying that back rent. And so that was a real intentional approach to make sure that people understood what this moratorium meant and understood that they would be responsible for that back rent once it expires. And this was part of some, this conversation came up, I think, often in court about this concern that come, January 1st, there would be a big wave of evictions. And so the county staff and their public outreach, especially for the December 9th deadline, were really pushing that and making sure that there was a lot of public education around that specific point, and making sure people were aware of what would happen and how they needed to prepare for when the moratorium expired. And the result of all of this, that target outreach, the social media campaigns, was a doubling of the amount of applications received per day. So before this campaign, the county was receiving about 90 to 100 applications per day. Afterwards, up to 200 applications per day. So a big increase, and that's why the county is still reviewing all these applications that it's still that's received over the past few months, because there's a really high volume of applications, and that's great because the county is going to be able to award a lot of rental assistance to these folks. So far, the county has supported more than 1,000 households. As we mentioned, this is about a $4,000 award, and that's about 3.8 months or so of rental assistance per client or per household. Any questions on here before we move on to the next slide? And next slide will also cover a bit more about the location of the renters and some details about the types of awards they received.
I would just say that on the Star Telegram this morning on the front page, there was an excellent article about the assistance that at least one family received because of our program. So.
If there's no other questions on here, we can move on to the next slide. And this is continuing to talk about rental assistance. We've got a map here that depicts the total amount of rental assistance grants awarded per city. And like small business, this is a filled map, so it follows the municipal boundaries. Each area that is filled in corresponds to a total award amount that's depicted in the legend to the left. So those colors correspond to specific dollar amounts, and that is the total amount awarded per city. So as with small business, the total grant amount is a function of both the demand among renters as well as the city population. So larger cities are more likely to have higher total funds awarded. So as a result, the most awards were issued in Arlington, about $2 million total. And the next largest group, that kind of forest green there, slightly less than the dark green there, Bedford, Euless, Grand Prairie, Grapevine, Hearst, Mansfield, and North Richland Hills are all in that $100,000 to $350,000 group. And a full listing of all the numbers and dollar amounts of awards per city is provided in the appendix. And as you can see on the left, the average rental payment per month is $1,100. And as we mentioned before, there are about 3.8 months on average of rental assistance provided per household. Folks need more than just 1 month of rent assistance, and as a result, there was about a $4,000 average award per person. Any questions on rental assistance before we move on to NGO? Okay. Okay, we can move on to the next slide. So here you'll see for the NGO program, the county enabled nonprofit organizations to continue operations amid increased demand and more challenging operating environments. Organizations sought assistance from many different fields, from food distribution to counseling. Nearly 80 NGOs were supported through this program for an average award of just above $100,000. All NGOs that applied for the assistance needed additional funds in order to adapt their services to social distancing requirements to protect the health and safety of their staff and clients. In some cases, this took the form of installing barriers and purchasing supplies to provide in-person services as safely as possible. But in other cases, NGOs took their services online, so to have virtual counseling and things like that. Nearly all NGOs that applied for funds were also experiencing increased demand for their services. And in many cases, nonprofits were serving new clients who had never previously come to them for support before. And this was most often seen for food banks. And we have a couple examples in the next two slides to get some examples of what, both from the client side and the NGO operating side, what that challenge looked like. And finally, many NGOs were launching new programs to meet the new needs experienced by their typical client base. So, for example, maybe a food bank launched a job service assistance or utility assistance in addition to other kinds of assistance they were providing as these new needs were identified and related to COVID-19. Any questions on the slide before we move on to keep about here? Okay, so we can move on to the next slide. We've got a couple testimonials from both an NGO client as well as an NGO staff member. So this first one that we're going to talk about, this slide expresses how important these services and supports have been. We've got a quote here from an HIM Center client and a photo provided by that nonprofit of food being loaded into a client's car. And this quote is from a client that had never before sought food assistance, and it really demonstrates how quickly this need arose in this person's household with job loss due to COVID-19. And it presents, really personal perspective on this increased demand that we have been discussing in the previous slides and also, throughout the course of this program. And this individual represents one of many in a similar position of seeking this type of assistance for the first time in their life. I'll just give a moment there for you to all to read it. Now we can move on to the next one. This will be our final slide for NGO. And this quote is from an NGO director that received assistance from the county. It speaks to the other side of this perspective of this increased demand, the operational challenges of dramatically increasing the volume of services that a nonprofit provides in a space that, for nonprofits that provide things food distribution, in addition to the immediate cost of increased food, there's also a need for additional staff, freezer and storage space, delivery trucks, tracking systems, and so on. And so this speaks to how, thankful that the NGOs were to have this type of assistance come through quickly. Any questions about the NGO program before we move on to local partners?
Yeah, Rachel, which I get for some of the nonprofits, they may serve the entire county, but others may serve just a portion of the county, but there wasn't a map on this one as there had been with the others. And then I didn't see a breakdown in the appendix, or if it's there, then I missed it.
We didn't, so it's a little bit difficult. So not all of the NGOs are tracking things like the residents of their clients. And so there are some things that, the NGO program can point to as far as what different overlaps and trends and themes were in the NGOs that applied. But most of what we can understand is from their application and from, the general reports that they put together, which is more on the general fields that they're in, the types of projects that they worked on. If they are working with a specific population, they note that and they say, either it's Tarrant County overall or a certain subpopulation within the county. But in terms of providing more detailed information that we'd be able to put into a map and show all of the NGOs where they're working and where they're having their impact, it would be a little difficult to say just given the type of information available and how much we all overlap.
Okay, very good.
So what we will do, we will give you a listing of all the NGOs and a description of what they had requested, and if we can do either countywide or partial county, we'll provide that for you. I thought we had that in, not in this slide deck, but in a different slide deck, but.
Okay.
We'll
Like in
figure-
the regular kind of weekly one
Yeah,
or so, right?
Yes, ma'am.
Okay, very good, thank you.
Any other questions on NGS before we move on to local partners? Okay, so we can move on to the next slide. So finally, the Local Partners Program met a diverse range of needs in the county as well. In addition to passing through CRS funds to municipalities, the program also funded healthcare and emergency response services, as well as chambers of commerce. And the chambers were also, in addition to being a partner in small business programs, they also had their own operating expenses they needed support with in order to stay afloat and to help their communities respond to COVID-19. For the municipality program, $61 million was awarded to 39 municipalities based on the calculation of $55 per capita. As we've reported throughout the year, county staff were very hands-on in supporting municipalities throughout this process, offering guidance around expense eligibility, reporting, documentation. And what we've seen is the strong need from municipalities to support public health and safety efforts for their residents. In total, county municipalities spent nearly $50 million, almost 80% of the total allocation, on public health and safety support. Municipalities also expended funds on continuity of public services. Often this included efforts to provide public services safely, either virtually or in a socially distanced environment in person. Additional key areas of support were in the areas of public health, medical expenses, and PPE. And in the appendix, we've got a breakdown of CRF allocations by city as well. Any questions on local partners?
So an example, the public services continuity, you said that was to provide services virtual or social distance. That could be, for instance, the library, right? Instead of you picking up your book in person, or maybe you do it curbside, or is that an example of the public service continuity?
Yes, there are also a lot of, so there are a number of different bill pays that were happening in person, utility payments that are happening in person, as well as assisting, different public employee staff, for example, public work staff, to get to their location sites in a safe way and be operating in the public in a safe way. So there's a lot of different ways when it says public services. It really spans, the range of the types of services municipalities are providing, as well as, the types of support and adjustments they needed to do it safely during COVID-19.
Very good, thank you.
Anything else on local partners? So if not, I think this brings us to end our presentation. As noted throughout, we've provided an appendix that offers a bit more detailed information on the testing sites, on the small business assistance grants, on rental assistance grants, and on the municipal CRF allocations. And to close, we want to say thank you to the court for the opportunity to support Tarrant County through this response. And of course, we are here to help going forward should you need our support.
So
I
this
have
will
a
be.
question, yeah. On page 18 with the rental assistance data, I don't see particularly Dow-Worthington Gardens as its own line item. And I would have to imagine that there were residents who rent in Dow-Worthington Gardens who would have applied for the program, or I guess been granted. So was that just an omission, or do we need to do some outreach there? Okay, thank you.
So this is the final presentation by Guidehouse. And their contract is now ended with the county. And Rachel, you and your team have done an excellent job. You've helped. I want to tell you how much I personally appreciate all the help that you gave my department and audit and budget and all of the county departments. And you guys did a great job. So thank you.
Thanks so much, DK. We were really happy to support you all.
Thank you very much, Rachel. We appreciate you.
So if we can continue on this particular item, normally we would go over the weekly status report, but that's been provided to you so you can look at the numbers, and because we want to also talk to you a little bit about the new legislation that passed last week at the federal level. And so with that, I'm going to ask Kristen to come forward and start that particular item. Once we complete this, I believe that the auditor's office, we're going to ask you to make some comments as far as FY20 and the closure of those books as it relates to the CARES Act.
Good afternoon, Judge and Commissioners. I'll begin by going over the rental assistance funding that we anticipate receiving through the stimulus bill, and then I'll turn it over to Mr. Schaffner to cover some of the other areas under the bill. And I do have a presentation, so I'll wait for that to come up. Thank you. Okay. So rental assistance. The bill includes $25 billion in rental assistance. This will come through HUD. The threshold for receiving direct allocations was lowered from $500,000 to $200,000. So in this distribution, the cities of Arlington and Fort Worth will receive their own allocation or their own distribution. So anything the county does going forward will not include those residents. We estimate, based on the formula provided, that Tarrant County will receive about $30 million through HUD. There will be a formal application process, but it is a formula allocation. Fort Worth
will exclude both Fort Worth and Arlington.
Yes, sir. Yes, sir. So Fort Worth has estimated that they will be receiving about $27 million, and that these are both in addition to Tarrant County's 30, and Arlington is estimating $11 million. So some of the guidelines, 90% of these funds can be used for rent, both backward and forward payments. Forward payment can only be provided once any arrears are brought current. Up to 15 months of assistance is allowed per household. That's actually 12 months with a caveat of an additional 3 months if deemed necessary for household stability. So it sounds like, and unless we receive further guidance, that will be at program manager discretion or staff discretion. Forward rent 3 months initially, and then 3 months at a time after that, if need is documentation of need is provided. The program does allow for 10% administrative case management services. Payments, like in our current program, will be made directly to the landlord. There is language that says if the landlord does not agree to participate or is not willing to receive the funding, that the assistance can be provided directly to their renter. I hope this is on. Oh, I skipped this. This program and funding will also provide assistance for utilities. So the rental and utility money can be sent directly to the renter to cover those costs. Landlords and property
owners. We're going to do utility assistance through our Human Services Department. Or are we going to set up a separate deal to do that?
That's still to be determined. We're working through all those questions. There are quite a few nuances within the bill, and this is a very large amount of money. So I will be back next week and or the week after to provide some updates on how we foresee the program moving forward.
Well, and this may be a question that has to be answered later, but I'd be curious if we know right now what is considered a utility.
That is a good question.
Yeah.
I don't believe that they haven't provided any definitions yet, but that is one of the questions that we have among others. So I'll be sure to provide clarification when we receive it. Okay. So the other major change really is that landlords can apply on behalf of their tenants. I think that could be a good thing. It puts a little bit more of the control in the landlord's hands. We will, however, have to be vigilant to be sure that the system isn't being abused. We, have been to date very vigilant and have caught a couple of cases where we've had to take a step back and reevaluate some documentation. But we will move forward with those guidelines as outlined in the bill.
Make sure that if the landlord applies, that there actually is a tenant.
Yes, sir, and the application must be co-signed by the tenant. Okay, so one of the major differences in this program versus the program that we're currently running is an area media income requirement. So this is the same as with HUD, all HUD funding. The tenant must be, or the renter must be under 80% AMI. I will show you an AMI chart on the following slide to give you an idea of what that looks like in our region. There are two ways to determine their income, however. Total income for 2020, which if someone had been unemployed would be reflected in that total, or income at the time of application. So I don't know yet, but I assume it'll be up to the applicant to determine which set of income to provide, which set of documents to provide. We will be required to prioritize households below 50%, and there will be reporting that I'll share on another slide to that effect. Household eligibility, the renter must meet all three of the things outlined here. They must have qualified for unemployment or can attest in writing that they have experienced a reduction in income, incurred significant costs, or experienced other financial hardship due directly or indirectly to the pandemic. They must be able to demonstrate a risk of experiencing homelessness or housing instability, and they must have a household income below 80% AMI. So the next slide, I'll just let you look at that briefly. It goes over the Fort Worth Arlington metro area AMI limits from HUD, and these are the 2020 limits. Some important deadlines. As of September, this funding, this program, it runs through the entire year of 2021 after we receive our distribution, which we expect sometime at the end of January, maybe early February. As of September 30th, 2021, any county who hasn't spent, or any recipient who hasn't spent 65% of their distributed funds will have to return, or the remaining funds will be recaptured by the Treasury. Any grantees who have obligated at least 65% of their funds will be in a pool to receive reallocated funds from those not spent by other agencies. I hope that wasn't confusing. Okay. A locality can request a 90-day extension if they are among those that receive a reallocation, which sounds like it would take them then through, my understanding right now is that it takes them through the end of the year. Once they receive that allocation, that's another question that we have for clarification. There is quarterly reporting required. The number of households served, acceptance rate, types of assistance provided, average amount per household, and average number of monthly payment covered, as well as income levels. Those will all be included in the quarterly reporting. And all of those numbers must be disaggregated by gender, race, and ethnicity of the primary applicant. So that is what we know right now. Again, we're still having conversations about how this will impact our current program, how to make that transition, what type of infrastructure or organization we'll need in order to deploy a program of this size. So we'll be back to share.
I would be especially curious to see with our current program, which was, I mean, it had a set of criteria, but it was not as income-based as this is, because a HUD dollar is kind of where is the gap, so that we see who are those folks that we need to make sure that they're not falling because they don't squarely fit in any particular program or based off of the how the dollars can be used. I want to make sure we're not missing anybody.
Yes, ma'am. We do recognize that there will be individuals who, like the testimonial we saw earlier, this may be their first time needing assistance, and they may not meet those income qualifications. And we plan to have a multi-tiered program to be sure we address anyone that needs assistance, and that may be through an alternate funding source, but we'll definitely include those considerations when we bring our plan to you.
Thank you.
Mm-hmm. Any other questions? Okay, I'll turn this over to Mr. Schaffner to finish.
Good afternoon, Judge, Commissioners. Regarding the rest of the report, again, just a high-level overview of various aspects of the omnibus 2021 omnibus bill, but two comments regarding rental assistance before we move on. One, just like we did with the CRF Coronavirus Relief Fund payment, there will require the county to sign a document saying that we do want the payment just like we did, I believe, Judge, you signed that document and we sent that in. So that will be one of the additional steps. The other one is that you have 25 billion total, it'll be formula allocated out. And then once it's formula allocated, the entities that choose not to accept the payment, their funds will be redistributed throughout the process. So there may be an additional layer of potential funding depending on how they do it.
Just a simple question. What are we calling this? Like, what is I know it's the whatever act, but what are we calling it in short?
The omnibus bill.
Okay, very good. And so then in future reporting, that's how we're going to refer to it as omnibus bill, sorry.
So technically, within the omnibus bill subsection M was the Supplemental Coronavirus Relief Act, which is like a supplemental CARES Act.
Yeah.
So let us come back to you with
Okay.
what we'll refer to this as a shorthand name, whether it's CARES Act 2, but we'll work on it. That's a great idea. Regarding public health, and a couple amendments to this slide, so there are 4 pots of money. We've outlined 3 on this slide for public health expenditures in the bill, totaling a total of $73 billion. The first one, the $22.9 billion, this is for actual vaccination and therapeutic development and distribution through the supply side. So this is not funds that the county is likely to actually receive any funding for. Like, this includes over $19 billion to purchase and fund vaccination development for COVID-19. The second pot, the $22.4 billion, that is would include COVID-related mitigation efforts, testing, contact tracing, those types of issues. What we can end up using those funds on will depend on how broad the regs are going to be. There's an additional $3 billion which can go to providers that have been impacted. And then subsequent pod, which Tarrant County Public Health would be eligible to receive. There's $8.75 billion for vaccine distribution. $4.5 billion of that will be going to state, territories, and localities to help with vaccination distribution. And then an additional $300 million is reserved for distribution into areas that of low-income or minority populations.
You said local locales?
Localities.
Is that us?
That would be us.
So I think
is that going directly to us?
I'm for sure of that, yeah.
Can any of this money be used for planning purposes?
We don't know yet.
So, Your Honor, you raise a good question as far as we know that the rental assistance would be a direct allocation to the locals. On this here, we probably believe that this is going to the state or staying with the federal government.
From the feds, probably to the state, and then to us as subrecipients. That's what we would anticipate this time. Partner agency programs. 3 different programs that, again, this isn't funds that we will be receiving, but ones that we want to work with our partner agencies across the county to make sure that they have opportunities to find this additional funding. $3.2 billion for broadband, $10 billion for child care and development block grants. This is the CCC DBG. It's got a really rough name, but this is $10 billion for child care programs, which is fantastic, and $413 million. This could assist Meals on Wheels, Food Bank. That's the programs that those pots could get at.
Back up.
Yes, sir.
The $3.2 billion for emergency broadband connectivity.
Yes, sir.
Can that be used by school districts to support virtual learning?
So I'm not for sure if it can be used for school districts. It's supposed to be used for larger programs to actually go out and potentially have individuals give...
To wire a community.
I'm not for sure if it can wire a community, but it can supplement individuals' payments for broadband to where it's a individual stipend.
And the concern there from an FCC standpoint is what's going to happen when that money runs out? How are the rural areas which they're trying to connect going to be able to maintain those payments And it's also, a lot of it, I think, is centered around telehealth.
And this is one thing I should have started out with, this is a huge bill. It's 5,500 pages. The bill is actually so large that the bill was prepared and ready for publication at 7:23 a.m. the morning that they voted it out. It didn't get online until over 2 p.m. because it was too large for the House's server to upload in their program. So there's a lot yet to be worked out as far as a lot of the details, but we will be keeping you all
And
informed.
there is a lot of
as to
money
these.
set aside in that bill for schools already that
And
are
we're about to-
excluded from this.
We're about to get to that one in particular, but I'll follow up with you on those particular items, sir. All right, key individual programs, the unemployment insurance benefits, that's been extended through March 14th at $300 a week. One note on this that I didn't realize today until I was reading news clips, but the unemployment benefits, that is considered taxable income. And there is some concern among some groups that for lower income individuals, if they are on unemployment or have received unemployment benefits, and they didn't make any subsequent income tax withholdings, that could potentially negative impact on their income tax return if they get one. So that's something to just be considering as we kind of move forward with a lot of these issues. There is $166 billion for direct payments. This is the $600 payment going out to individuals, and a 15% increase on SNAP benefits through June the 30th of this year. All of which, again, helping individuals. Other programs, Judge, you mentioned the Education Stabilization Fund. So this program totals $81.8 billion. 5% of that will go to the governor's, what's called the Governor's Fund. It's outlined in the bill. Each governor has one, and they can use those funds for various programs. I believe in the CARES Act, the Texas Governor's Fund was used to cover the competitive grant process to cover some programs that school districts had for PPE and other types of issues during the spring. And then 67% of it goes into the ESSERS Fund, Elementary and Secondary Education, which this fund, so the funds will come from the feds to the TEA, to the state. And then the TEA must grant out 90% directly to the school districts of this fund, who then can use it for 15 different eligible activities. So that's a tremendous amount of money that'll be going to our local school districts. And then 28% of the funds will go to higher education for all sorts of different programs, which is really, again, a very good thing. There's $2 billion for FEMA to meet COVID-related needs, and $284 billion for additional small business grants through the SBA, through the Paycheck Protection Program. So just want to flag that'll have a second round, and Lisa, correct me if I'm wrong, but if you've applied, if you receive the first round of PPP, you can receive a secondary round of PPP. So just so everyone is aware, those are other programs. And then transportation, a minute about this because I think it's particularly important. $14 billion for the FTA, Federal Transit Administration, in order to help transit agencies that have been struggling with their operational revenue and operations costs that'll go through. The COG will actually receive those funds and then send out to the transit agencies. $16 billion for the FAA for the airline support, another $2 billion for the FAA for grants to airports, and then finally $10 billion to the Federal Highway Administration, which will be able to go out to the states. And I expect that we will be having some significant conversations during the legislative session over those funds and how we'll program those in subsequent years.
That's for the nation?
The $10 billion for the nation, sir. Yes, sir.
So we spent that much in Tarrant County, too.
We generally, yes. But it is $10 billion for the nation. General outlays of how we get our funds, it's probably somewhere around $750 to $800 million to us, to the state. So with that, any questions?
Before you leave, I got this little certificate from the U.S. Census 2020 thanking that they erroneously put my name on here, but you're the one that did all the work, so here is your, just scratch it out.
Yeah.
Because if you'll just scratch out and put Russell in there, you're.
Russell, the census guy.
Well, thank you very much.
Yeah, put the census guy.
Well, I will admit, I mean, also say from that standpoint is that for the budget that you had, we did a whole lot better than the county to the east of us who spent about 30 times more than we did.
Well, our census numbers, we came in over 2 percentage points higher on self-response rates than we did in 2010. And during a pandemic, I think that's a real mark and a real testament to the incredible work that not only the administrator's office did, but all of our different departments and elected officials across the county. Everyone did a fantastic job. We pulled together, and if anyone needs a T-shirt, I'm happy to assist. So thank you.
Or a hat, right?
Yeah, or a hat.
So we have one other issue as it relates to item number 1, and that's some discussion with the auditor's office as it relates to COVID expenditures in FY20.
So just an update that the auditor's office, working with the administrator's office, working with budget, we need to close the books for 2020. They're still not closed, and obviously the audit is going to commence. And with that said, we're proposing, and all of us are in agreement, that we're going to take $6.5 million of public health salaries out of the public health fund and $10 million worth of public safety salaries out of the general fund from 2020 and use CARES money to fund those, which will then free up an equal amount of additional revenue to be used that wouldn't be CARES money. So just so you understood what the number is, which would leave another $38.5 million of CARES money still available to be used in 21.
Got it.
Thank you.
I would move that we do what she said.
Second.
We have a motion and a second. Any further discussion? Please vote.
There you go.
Commissioner Johnson, are you still there?
Yes, I am.
And you're voting yes?
Yes.
Motion passes unanimously.
He's getting lunch.
He got lunch.
Wait a minute.
We didn't get any lunch.
I sure am sorry.
Yeah, I wouldn't tell. All right. Was there something else?
I have two other items. The first is I need to ask the court to approve the release of $1 billion of collateral as outlined in your court communication.
So moved.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the other item is we're asking the court to approve the Federal Home Loan Bank of Cincinnati irrevocable letter of credit in an amount not to exceed the $200 million and extend the term. Short discussion is previously our letter of credit had been through the Bank of Chicago. There's been some regulatory changes that we've attempted to outline here in the paragraph that says that they can no longer use Chicago, and so Chase is proposing that we use the Federal Home Loan Bank of Cincinnati, which from our review appears to be comparable. Obviously, Chicago is a much larger metropolitan area than Cincinnati, but I don't really have anything that would say that this is a bad switch, and they're saying there is no choice. That the regulations are requiring Chase to no longer offer it through Chicago. So with that, we're recommending that we continue. We already have a letter of credit, and that we continue that letter of credit as outlined in this communication.
Move for approval.
Second.
We have a motion and a second. Any discussion?
Yeah, I have a question. Isn't there a home loan bank local and do they have a branch comparable to Cincinnati or Chicago in the DFW area?
I'm sure there's one in Dallas, but I
Okay, I was just curious as
Right.
to, this is somebody that one of our banks used as
This is
the-
J.P. Morgan. Instead of providing actual government securities, like you just released the
Right.
collateral. So no more than $200 million of whatever our balance in the bank is can be this letter of credit.
Okay.
Everything else has to be those actual agency, U.S. Treasury or agency, U.S. fully secure debt. And so we're just moving that letter of credit, though, from one institution to another at J.P. Morgan's request.
Thanks.
Please vote. Commissioner Johnson?
Yes, turn me on here quick. Yes.
Thank you. Motion passes unanimously. Come on down, Tina.
Move to receive and file personnel agenda.
Second.
We have a motion to second to receive and file personnel agenda. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank
30
you.
years, huh?
Yes, sir. Seems like it was just yesterday. Or maybe a few years ago.
Yeah.
We have two additional items for the court today. The second item, we're asking the court to approve an extension of project employment in the district clerk's office. Of course, we've had a couple of these requests before you before. The incumbent is involved in the ongoing scanning project in the district clerk's office. There is no impact to the general fund. If you approve this extension, this will take this individual's employment through January 8th of 2022. We have visited with the district clerk's office. This incumbent the plan is to consider this individual for employment, full-time employment, later this year.
In another position, I'm sure.
Yes.
So
In a
this is
full-time
about the
position.
17th extension of the,
Pardon?
this is about the 17th
Yes.
extension of this.
Does it ever end?
No.
Does it?
No.
Until we get all the documents scanned and paper destroyed, because that's coming out of the dedicated fund. This is the supervisor for this department.
Good. Do I have a motion?
So moved.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. Our third and final item, we're asking the court to approve a waiver of terminal benefits for domestic relations. Ms. Glenn has a caseworker who's going to be leaving county service, who left county service in December. The waiver is for 218 vacation hours. That was whittled down from 394 vacation hours. We are estimating net savings to the general fund of approximately $10,300 and some change. That does include fringe benefits.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
You said it was a cost saving? Because
Yes.
my notes
Yes,
had
sir.
it was a cost. Okay, savings. All right.
Thank you.
Purchasing? Come on down.
Good afternoon.
Hey, Melissa.
We have one item for your consideration this morning, an award recommendation for bid number 2021-013, annual contract for road flares for the Sheriff's Office, awarding to the primary, secondary, and alternate vendors listed in your court communication per unit price.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you, Melissa. Are there any appointments today?
I have one for civil service, for child protection services. Elaine Close.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Are there any others? Okay, then you have before you the claims, including the addendum.
Move approval of the claims including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Did we have any bonds that we needed to do since?
Yes.
Who's going to talk to us about them?
We do that right after closed. I'll have those, I have that file on my desk.
Okay. Then we have a briefing item, public safety assessment implementation. Y'all come. Happy New Year.
Happy New Year.
Hey, Judge.
Hello, Judge Whitley and Commissioners. It's great to be here in front of you today, and we have a PowerPoint. Oh, it's up. So, where do I push? Advance it?
Go down your slides.
Okay, wonderful. All right, very good. We
Do
just
what
wanted-
you wish. If you would like, since you're speaking there and I'm more than 6 feet away from you, you can take the mask off while you're speaking, but it's totally up to you.
I know from experience, it's a lot easier to understand people when they don't have the mask on. So I want to tell you all about where we are with the public safety assessment. I know you guys know that we have JMI as our consultant, and they've been helping us fit the public safety assessment to our jurisdiction, and I wanted to give you an update on that process. So we want to get you to a better understanding of what the public safety assessment is and what it is not today, and where we are with that. So the public safety assessment is research-based and data-driven. It is something that is used across many jurisdictions to provide judges objective information to use in bond setting. I'm going to go through the tool step by step so that you have a really good idea of how it works and what the factors are. And of course, we'll be available to take questions at the end. Generally, the public safety assessment uses criminal history and other criminal history information to plug in to this tool to make a recommendation to judges about bond setting. What is it? The Arnold Foundation started the public safety assessment. The research basis, as I pointed out, 750,000 cases in multiple jurisdictions across the United States to identify which factors in the criminal justice system can tell us whether someone is likely to come to court, whether someone's likely to have a new offense while they have a case pending, whether someone's likely to have a new criminal offense, a new violent offense while they're on bond as well. It does not include race, gender, employment status, level of education, or substance abuse history or mental illness as part of its analysis. The features of the public safety assessment, as I've said, it's nationally validated across many different jurisdictions. It is transparent. If you'll go to, actually, I'll have it up here in a minute. Advancingfreetrial.org is the website where you can look up exactly what the factors are that are used. I'm not an expert on the public safety assessment factors, but you can look at them and know what they are and exactly how it works if you would like to do that. The separate factors that we're looking at: court appearance, safety, like new criminal activity, and new violent criminal activity. That's what we want to know about someone when we're setting a bond. How likely is this person to not come to court? How likely is this person to commit a new crime while they're on bond? How likely is this person to commit a violent crime while they're on bond? And that helps judges make data-driven decisions about what the bond amount should be and what conditions should go along with that.
Judge, do you know, is that determined based upon questionnaires that the individuals are filling out, or that the magistrate has knowledge of, or is it just based upon whatever that individual is brought to that in front of that magistrate for on that particular occasion?
The public safety assessment is, the information is taken from criminal history and from documentary history, not from what the person says, not from anything that they fill out. Now, when people are brought in front of the magistrate, they also fill out financial information sheet so that we know where they are financially, which is a required consideration in the Code of Criminal Procedure in setting bond. So what the public safety assessment is not. We don't use the public safety assessment to say this is the person's bail. It is a tool. Right now we use the static risk assessment. So we have an assessment that we put in front of the magistrates right now. This is just a different assessment, but it is a much better researched and nationally used assessment. We just use the static risk assessment because we weren't able to use this one right away. We have to go through the process that we're going through right now. This is not the only information that can be considered. If a defense attorney or a prosecutor or anyone else in the system wants to bring us additional information to consider, we can also consider that as judges in setting bail. We don't make detention decisions.
And
And-
Judge,
Yes.
those items that you listed earlier that were not considered as a part of this assessment, they can be considered by the judge layered on top of.
Exactly. This is just one piece of information,
Right.
but it's a very useful piece of information because it is data-driven and it's researched. So we know what factors to look at based on the research behind the public safety assessment, and that helps inform our decision-making. So this is not a yes or no as to whether someone's going to do well or show up. It's just a data point. And this in itself is not bail reform. That's an ongoing process. I mean, that's a catchphrase that you may or may not have heard. That's an ongoing process that we're engaged in to make sure that we are making the right decisions and data-driven, personalized decisions as to each person who is arrested when they're magistrated. I don't know if you all were aware of it or not, but on December 28th, the Fifth Circuit has issued another opinion in the Dallas County bail lawsuit. And I'm not going to go into that now because it's not really part of this, but I can tell you it is an ongoing process. They've made some new decisions for Dallas County that have some implications for all the counties in Texas and really across the nation. And I commend it to your review because it's an interesting decision and it has some new information in there about who they think are the proper defendants. But one of the points that they reiterate yet over again from Dallas County and from Harris County is that the proper way to set bail would never be a bail schedule. We cannot look at somebody's charge, somebody's level of charge and say this is how much it's going to be for you to get out of jail. That is never proper, and the Fifth Circuit reiterated that yet again in their December 28th decision. So let's look at the factors. And it's a little bit small, but as you can see, the first column is FTA, failure to appear. So we look, these factors are the ones that play into failure to appear. The first one is pending charge at time of the arrest. So for failure to appear purposes, if you have a charge and you pick up a new charge, that is counted against you for your failure to appear score. So that's a factor that is weighted, that's a point. And you want low points, not high points. So prior convictions are factors in failure to appear, prior failure to appear within 2 years or older than 2 years. The next column is NCA, new criminal activity. These are the factors that the data tell us show that somebody is more likely to engage in new criminal activity while they're on bond. Commissioner Allen, do you have a question?
Not yet.
Okay, not yet.
I will.
All right, great. And new violent criminal activity is the third column. So these are, the data tell us from all of the research that the Arnold Foundation has done, that these are the factors that show us that somebody is likely to commit a new violent criminal activity while they're on bond. Now, I can tell you from our particular deep dive into these numbers with our consultants, the overall absolute risk of new criminal activity and new violent criminal activity is low, even for high-risk groups. I mean, it's in the single digits, but it is a factor that we need to consider as judges, because the Code of Criminal Procedure commands us to consider community safety in setting bonds. So let's go. Okay, so we'll go into this a little bit more in the next slide, but it just shows you that some things are weaker and some things are stronger in measuring failure to appear, just like we saw in the previous slide. Some things are factors and some things really are not factors. So I think that's better explained in the next slide. So for example, this is how it works. If you have a pending charge at the time of your arrest, so you're already on bond for a charge, you get arrested for a new charge. On failure to appear, that adds a point to your risk of failure to appear for your court setting. A prior conviction, either misdemeanor or felony, the data tells us you're more likely to not appear for your court setting if you have that. A prior failure to appear, I think that's pretty much self-explanatory. So this is the way that it works. You get the lowest point number one, the failed to appear score number one is the lowest if you have none of these factors. That tells us that you're almost certain to appear for everything, and that is something that we need to know as judges when we're setting bail. On to the next. New criminal activity. This is as you can see, we have a new factor in there at the top. Age at current arrest. Younger people are more likely to have new criminal activity while they're on bond for a pending charge. That's what the data tell us. So that's a factor that shows us that we have to consider if you're young, you get a point, you get 2 points here. That's actually a more strongly weighted criteria. Pending charge at the time of arrest, that's going to get you the most points. If you have an offense for which you're on bond, you get arrested for a new offense while you're on bond, then, that gives you 3 points because you have actually committed an offense while you're on bond, so the likelihood that you're going to do it again is very high, according to the data. So I'm not going to go over every single factor, but you can go down and see these are weighted differently for the different, if you have 3 or more violent convictions, you get more points. Failures to appear, you get points. And prior sentence to incarceration, you get points as well. And then over here, you get a scaled score when you add all the points together. And then we have the violence flag. The violence flag is just an indicator that tells us whether someone is likely to perpetrate a new violent offense while they're on bond. The idea of what a violent offense is something that the stakeholders have been discussing. We met as a group. We had the judges and the DAs, the defense bar, the police departments, probation, to talk about the various offenses that are under the Texas Penal Code and help us decide what qualifies as a violent offense. And this is when we have a violent offense list that we can draw from, then we say, are you on bond for a current violent offense? That is a factor that shows us that you're more likely to perpetrate a new violent criminal offense while you're on bond, and so on and so forth. So these are what the data tell us that make you more likely to perpetrate a new violent criminal offense or while you're on bond. So once we have these scores, then we plug these scores into a matrix. And the matrix informs the judge about what the public safety assessment recommends as far as the level of supervision for this person. So level 1 would be likely, we haven't set our conditions matrix yet, but for example, in other jurisdictions, the level 1, you would have no conditions whatsoever except for come to court. That's it. Come to court when you have a court setting. Level 2, you might have a check-in with a probation officer. They might call you, or they might have you call in or log on to a website and check in once a month, for example. A level 3, you might have a personal check-in twice a month with a probation officer. Level 4, and so on and so forth. Up to level 5, you could have GPS. You could have a number of different ways to monitor you. So you can see these levels are supposed to correlate to people's risk. And for example, Allegheny County, there we go. Allegheny County, which is Pittsburgh, Pennsylvania, 50% of the defendants fall into level 1 or level 2 with 0 or very little monitoring. And we don't know exactly what that's going to be for Tarrant County, but we anticipate that it's going to be somewhat similar. This assessment doesn't, as I've said, it doesn't assign bail. It's a tool that helps us know what data points tell us that has been validated all across the country about this particular person and what their risk is to not show up or to have a new offense while they're on bond for an offense. So this is objective information, Most people will have few to no conditions under this system, which is where we want this to be. We want people who are low risk to be out of jail, unmonitored, going about their lives, and showing up to court. And this data tells us how to identify who those people are so that we can make sure that that happens. Does the PSA discriminate? The PSA does not take account of as I said, race, gender, education, employment status, residency, or demographic or personal information whatsoever. It is a records-based process where we look at somebody's official government records, plug that information into the assessment, and that gives us all of this information. And as I said, that this helps us identify the people who are going to be absolutely no risk and just need to be out of jail. Is the PSA soft on crime? The PSA helps us be smart on crime. We want the people who are low risk to be out and to be as free as possible while they're waiting on the resolution of their case. We want people who are high risk to be monitored carefully so that we can assure public safety and make sure that they come to court. So the PSA results in Harris County and Dallas County, two jurisdictions that already use the PSA. As you can see, their lowest level, a third of people are on their lowest level in both counties, and 71%, 71% of people in Harris County are on level 1 or level 2, and 56% in Dallas County. So this helps us find the low-risk people and treat them appropriately, as well as the high-risk people, which is exactly what we want to do as judges. How do we tell if it's working? After we've used the PSA, and we don't have it running yet, but we expect early in 2021 that will start happening. After we start using the PSA, our consultants will come back and validate the data to make sure that the people that we're saying are low risk are actually coming to court, are actually not committing new offenses, and the people that we say are treating as high risk are actually engaging in some kind of risky activity, that we're catching the right people who need to be monitored and not monitoring the people who don't. So right now, I think we've just about finalized our violent list, the violent offense list that we'll use to raise the violence flag. The recommendation matrix is still in process. We're still working with the consultants to make sure where our recommendation matrix is going to fall. And we're training court staff. We're hoping to start at the end of January and have it fully rolled out in March.
When you talk about monitoring and doing the validations, who is doing that when it comes to like the level 5 or level 4?
Okay. Those are two different questions. The validations are done by the research team, but the monitoring is done under the order of the court by the probation department.
So it is the probation, even though they have not yet been convicted?
Right, because probation has the pretrial services.
Because we've done that, we moved that over a year or so ago.
Exactly.
And we fund that pretrial aspect with GR revenue.
Okay.
Judge Westfall, I applaud this effort. I have been advocating for Tarrant County to get to this point with the Arnold Foundation assessment tool for 4 or 5 years now, and it's been a process.
I thought it was going to be like switching from a slotted screwdriver to a Phillips screwdriver. Just hand me the assessment. We'll just plug it in. It's not like that at all.
It's not
but
like
it's a
that
better
at all.
assessment for having a process.
I am encouraged that we're moving to a data-based assessment system. I recognize that no assessment system is perfect. This assessment system does not consider race, gender, economic circumstances, education level, which is a good thing. But it also does not consider over-policing in communities of color. That would cause certain defendants to accumulate more points just because there is more contact with the police in certain communities. No system is perfect, but this is the Cadillac of the industry.
I agree.
And I applaud all of y'all's efforts to get to this point. And I look forward to seeing the results of the implementation of this system in Tarrant County.
Thank you, Commissioner Brooks.
I do have some questions. I certainly echo what's been shared by Commissioner Brooks. I don't have a page number here, but here's what I'm trying to reconcile in my head is if we're using prior conviction data as one of the assessment points, and that prior conviction could have been based off of the status quo system that we know doesn't work, like how do you reconcile that?
I think what Commissioner Brooks said is true. I mean, you have to have some data-driven way.
Sure.
And the data that we have that is somewhat predictive is objective, not subjective, is the data from our records. So it's not perfect data, I agree, but it's the data that we have. And it's much better than a non-data-driven decision-making process, which is what we've had in the past in many places that has not worked.
Sure. Okay. Going to the slide where you present data on Harris County and Dallas County, they had the numbering for the levels are different. And what does that mean for comparison's sake, and then what does that mean for us?
Well, that part of this process is that every jurisdiction decides what their matrix is and what they're going to do in response to those different matrices. So let's go back, if I can go back to that. There we go. I think one of the main differences is that Dallas is called their first level, level 0 rather than level 1. And to them, the 0 means we're not going to watch these people at all. There's no reason. They're very low risk. We don't need to touch them at all. They're going to come to court. There's almost no chance that any of them are going to reoffend or pick up a new offense while they're on bond. So there's no reason to mess with them at all. And that's what they do. I think that level 1 is probably the same thing in Harris County. It's just called something different.
So basically, Arnold's survey has 5 levels.
Well, they let you set your matrix up any way you want.
Okay.
We could have 20 levels or 11 or 5 or 3. It's just whatever level we think, how granular do you want to get the information that you want.
Okay. The other questions I had, I think you answered. Let me double check. So in us determining how the PSA is working, the mention of the 3 total validations over the next 3 years, I don't want to make the assumption that's an annual, like every year. So will you go into greater detail about that validation and then how that information be presented so that we know how well it's working or not?
I don't have tons of details about that.
Okay.
I think that it's a 3-year process, but I don't know for sure, so I've got to throw that out there. I think that it's going to be annual, but how long is our contract?
It's a 3-year contract
Okay.
with implementations. It'll be on an annual basis, Commissioner, and as the judge said, what they do is they determine if the people that we deemed high risk were actually high risk, and the people that we deemed low risk were actually, and then we adjust it accordingly. We're just using the data to drive the decision.
And I anticipate that as we get those analyses, we'll bring them back to you so that we can keep you updated and make sure that everyone knows how it's working, or if it's not, if it didn't fit well, how we're adjusting it to make it fit better.
Judge, is there any estimate on what the cost is when somebody doesn't appear for court? I mean, you've obviously got staff in place, you do something prior, anticipating that person will show, they don't show, you got to reshuffle, reschedule. Is there any estimate, not necessarily your court, Tarrant County Court, but on a bigger scale on what that cost might be to the jurisdictions?
It really depends on what they didn't show up for. If they didn't show up for docket call where I had 60 other defendants and their attorneys show up, then it's the cost of whatever it takes them to get back in court, whether it be a phone call, issuing a warrant and having them arrested, which is obviously more costly. So oftentimes the defense attorney can make a call and say, where are you? Get down here. And that person responds. Or finding out, are they in the hospital or did they have car trouble, to try to figure out why are they not here and how do we get them here. If somebody is at their trial or on a trial date where they don't show up for jury selection, then we've called 60 people in and we have to pay them. So that's obviously much more costly than missing a docket call. So I'm not sure what specific cost. I mean, there'd be different costs for different things.
Okay. And then you would have to at the same time, you have to translate that into, at each one of those levels where that person didn't appear, was there a bail or was there a bond that was established or not? Because you could have a level 5 where there is a bond and they not show, and then you've got the reimbursed cost. Or you could have a level 1 and they not show, and again, that's going to probably more likely might be in that docket. And from the docket standpoint, the attorney time we've got, but that's just one more of 60 cases or one less of 60 cases.
Right. From my perspective, there's no cost except for the cost of ultimately getting them to court. But a level 1, if they're a true level 1, they should be in court because they're going to appear. That's why the data tell us that they're a level 1. A level 5, from my perspective, because I handle all felonies, I mean, we've had some number of very high-risk people out on bond, and the higher the risk, the more time that they're facing, the more serious the offense, the more likely they are to not show up. And all of those people are on secured bonds, on monetary bonds, the people at the highest level, because they don't get personal recognizant bonds.
Okay, I'm trying to recall the presentation. Do we have something in there that says, okay, here's all the people we put out on level 1, here's their failure to appear percentage?
That's what we're going to have. We haven't actually started using the PSA. I'm giving you guys a preview before it rolls out.
But has there been other places where we've seen that and we have an idea of what to?
That's in the data. I don't have the underlying data with me, but I can send it to you because JMI has gone over all of that with us to show us what the likelihood is for the various levels if we've applied our data correctly and we have the right people in that level.
Okay.
The validation is to make sure that the level 1 equals the proper risk, so that if there's more people not showing up that are level 1, they need to adjust their level 1. That's what the validation is intended to do.
Thank you. Any other questions? Thank you all.
Thank you very much.
Thank you for your presentation. Sorry it was a long time before you got up here.
But it was a long time for us too.
I know.
Well, we brought them lunch and refreshments while they were waiting.
Just a couple of things while on a different matter, while I'm not even paying attention to that. I did have a text from the mayor that said, Betsy, that said that Grimes will be ready Thursday, Bolin will be ready tomorrow. So Bolin is the alpha pod, and Grimes is the big vaccine for the 1B folks. So
And that's from Mayor Price?
that's from Mayor Price.
She's still working?
She is till May.
So we can go to item number 9. These are the bonds and certificates of self-insurance. So I have a list here now for certificates of self-insurance, and these are for the constable's offices, the reserve officers. There's a large number of them. I'll try to read them off, and then if the court would like to take a vote, you can vote on all of them at one time. Precinct 1, Don Jensen, John Stenick, Kay Crowell, Cliff Johnson, Todd Tealman. Precinct 2, Samuel Bryans, Don Harris, Calvin Hudson Jr. Precinct 3, Adam Bush, Joshua Brantz, Amber Kalia, Christopher France, Gary Gregg, Matthew Petrie, Jonathan Price, Clifton Sprayberry. Precinct 4, Brian Ayers, Alan Beadle, Leland Betzel, Renee Hill, Silas Hook, Richard Morris, James Parker, Doug DeWeese, Ray Jones. Precinct 5, San Juan Becerra, Andy Bryant, Matthew Enriquez, David Collins, Frederick Jepson, Michael Nelson, Johnny Pettyjohn, Andre Molyneux. Precinct 6, Josh Dacus, Jack Ely. Precinct 7, Mr. AWE, I'm sorry, I don't know how to pronounce that. Michael Brown, Jerry Hickson, Richard Knight, Gregory Mills, Robert Newberry, Chad Prida, Michael Powell, Michael Thompson, Waylon Telefuse. Precinct 8, Gilbert McGellan, and Tommy Jackson. All of these are certificates of self-insurance. I have signed all of those. We're requesting that the Commissioners Court approve those. They're each in lieu of a bond. It's self-insurance of $2,000 per person.
So moved.
Second.
We have a motion, a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
That's all we have at this time, Your Honor.
With that, do we have a closed session?
Yes, we do.
Then we will recess our open meeting, proceed to close to discuss items exempted under section 551, 107, 107, 207, 4, 076, and 087 of the Texas Government Code.
They have one person. We're ready.
Having returned from closed session, there being no business to conduct at this time, we are adjourned, and please adjourn for Mr. Duncans and Clyde
Peach.
Clyde, landslide Clyde.